Caris Medical Practice, Ebony speaking.
I'm Dr. Butterworth. What can I do for you? Right. OK.
It's quite a size. It's all fat in there, so we're going to send it off to the lab.
How often do you have your bowels open and what does the poo look like? I'm sorry, I know it's a bit embarrassing to talk about, maybe.
I think it's just loneliness nowadays, yeah.
OK.
When I put my foot up in the air, it felt like my blood had turned to acid and it was just burning. If I move my toe, it's ridiculously painful.
Room 5, come on then. Let's go. Oh, room 5, so which one?
Hello,
Hi.
hello. Come in, boys. Come in. Come and sit
Grab yourselves
down.
a seat. We've got both of them. I believe you've seen both of them.
Both of them
Brilliant.
together, right. Who gets to
Brilliant.
go first?
Oh, yeah, we'll go youngest to oldest.
Go on
I
then,
think.
there
We'll
you
youngest to
go.
oldest,
Right,
and
so
then
my
JJ.
name's Dr. Card. How can I
Hi
help?
there. He's had his ear syringe before, build-up of wax,
Yeah.
but most recently we've started noticing the TV's really loud, he keeps turning it up.
Sure.
He's ignoring us when we're saying stuff to him now, whether that's just a kid thing or whether there's actually another build-up of
Yeah,
wax.
yeah.
But I thought it best, before he goes to school, just to get it checked out.
No worries. What do you think, Alex, and what do you think might be going on?
Sometimes I just feel like wax is like flooding up to the top of my ears, and it's like my ears are really itching and stuff.
OK, OK. And when you say it's flooding, what does that feel like?
It feels like it just magically adds more and more wax and then it piles up so I can't...
Your ears do magically add more and more wax, so that's their job, you're right. Right, come on then, let's have a look at you. How's your school holidays been?
Fine.
What have you been doing?
I went to see dinosaurs, that was good too.
All right.
Which dinosaurs did you see?
Quite a lot.
Did you? What's your favourite dinosaur?
The T-Rex.
That is the best one, isn't it? Right, I'm going to do a little trick with you, right? Turn around and look at your dad. I'm going to whisper something in your ear and you tell me what I'm saying, OK?
Okay.
99.
99.
Good.
84.
Perfect. Good lad. Cheers. Right. Not a build-up of wax, but there is a slight fungal infection in both ears.
Right.
Which is why it's a bit sore and it can get swollen and that can affect the hearing as well. And,
yeah.
and it gets very itchy.
Yeah.
Itchiness is the main complaint normally with these kind of things.
Yeah.
But they're easily treated. I'll give him a spray for his ears and that will get rid of it. Right, just bear with me 1 second.
No problem. And then we'll get you seen too.
Six, number 6. Are you old? It's, where's number 6? This way, Vera. 7. Oh, no, it's toilets. Well, there should be a 6, shouldn't there? That's 5. 6, look, we've passed it. Oh, my goodness. Yeah.
Come in.
We've passed you once, I'm sorry.
My name's Dr. Hutt. What can I do for you?
For a long time now, I have cramps in my leg when I go to bed.
In your legs, OK.
Really bad.
OK.
It's so bad. You wouldn't think those big toes could stand up solid. You can't even bend them.
OK.
It's vicious.
And is it just at night?
It's just at night time. Sometimes I get it in my groin here, but I can put up with that. It's when the legs start.
Okay. And does it wake you up?
It don't even let me sleep.
OK.
It's really bad. Just don't look for it to go into bed. As soon as I lay down and I try to creep into bed to pretend my legs don't know, you know, I lay down and then it starts. It's like icy cold water running down my legs.
All around it. Okay.
And then it sets in.
What helps? What have you tried anything?
I've tried something. I got something from Health Shop. I did I fetch it when they were there?
Have they made any difference, is it?
From Health Shop.
OK. That's not made much of a difference, has it?
Nothing at all, no. This is the second bottle.
Okay. What's your diet like? Do you eat like...
I eat plenty.
And do you eat dairy products and milk and cheese?
Everything you can imagine.
Yogurt and all that.
I've got a massive appetite.
Any swellings or anything? Can I just have a quick feel?
No.
Just have a quick feel, all right? No pain when I'm pressing?
No. Just the silly old cramps that I keep getting really bad.
Cramps are quite common. We do see it quite commonly, like, you know, people complain, especially at night time.
Yeah.
And it's called night cramps. Now, sometimes if there's some deficiency, like lacking vitamins, or even if it's lacking calcium or vitamin D, things like that, they can give you cramps. I would like to check your calcium, your vitamin D, and some vitamin B12 and those sort of things, and make sure that you're not deficient in iron in any of those that could be contributing to your cramps. How does that sound to you?
I'm chuffed if it's better than that there.
So what I will do is I'll write down what blood test we're doing, and on your way out, if you can just book in with the nurse for a blood test, and then I'll see you back with the results. Of the test, and see how you get on with it. If this is not helping you, then just don't take them. If they're just magnesium, so see
Seem
how
a waste of time then.
Yeah. Is that okay? So
Right.
anyway, nice meeting you.
Thank you.
Right, Jake, so tell me, is one more itchy than the other one? Yeah? OK, that right ear does look a bit sore, actually. You don't feel poorly or anything like that? There's a little bit of pus in that ear too.
Right.
Yeah, so we might have to give you some medicine to get rid of that. What do you reckon? Yeah?
So I have to have a spray and he has to have a medicine.
Yeah. Who wins?
Me.
Hey!
Yeah, I think that's true as well.
No.
Or is it a draw? Are you allergic to anything?
He's not, no.
I'm allergic to gas.
Gas?
Everyone's allergic to poisonous gas, man. Especially Dad's gas.
Something wrong. Yeah, cheers for that, son.
So, medicine for Jake 3 times a day for 5 days.
Yeah, no.
And then the spray 3 times a day, and that's for 5 days as well. And both ears for
Both
that one.
ears, yeah.
Oh, so it's a draw then.
It's a draw. It's a draw. Yeah. There you go.
OK, so... Right, boys, say thank you to Dr. Khan.
Thanks, Dr. Khan.
My pleasure. Nice to see you. Cheers,
Cheers
Dad.
a lot. Thanks a lot. All right, come on then, guys. Excellent.
Right,
Thanks a lot. Cheers. Bye-bye now. Come on then, guys. And boys, thank you for that. You were really good in there.
Come on, you love sitting next to me, don't you? Oh, I do. I know that you're being sarcastic, but I also know that you're not being sarcastic. You love my food. And I don't blame you.
Right. So something down below, is that right?
Yeah.
Tell us a bit about it.
It's growing up.
It keeps growing, getting bigger and bigger.
Growing up.
OK.
First it's small, you know, the dot, and then grow up. Now it's really big.
OK. Does it ever leak or discharge?
No
or
leak,
anything
no
like that?
discharge, no nothing.
OK. Would it be all right to have a quick look at this area?
Yeah, that's fine.
So we can plan what to do. Whereabouts? It's right down...
On the balls, you know.
OK. What's the best way to look at it? Is it standing up or lying down?
No, standing up is
Standing up, is it? OK. All right, yes. I'm just going to have a gentle examination, if I may.
Sorry.
It's a little fatty lump, I think, isn't it? OK, that's fine. Do wrap up. Thank you. Right, sir. If you wouldn't mind, have a rest on here.
If you can pop things down, well, I'll just have that just to cover you up and keep your dignity.
Are you set? Here we go. 3, 2, 1.
He's got cyst-like, smooth swelling about the size of a tangerine.
Nice big chunk there.
I don't know. I don't like all this blood.
You've got a big smile on your face. Are you excited?
He just likes to see pain inflicted.
If I start snoring, just pinch me.
We'll stick you with a needle. That'll wake you up. Okay. So have you been waiting long for this appointment? Or has it come quite quickly?
It's come quickly, yeah.
We try and offer a fast service.
Same bottle.
Thank you. Right, it is going to sting, I'm afraid. OK.
That's all right.
All right.
I'm just going to gently...
Sorry.
Right, here we go. 3, 2, 1.
Well done, my love.
You'll feel a bit of pulling and pushing, okay, but it won't be sharp.
How are you doing, love? You all right? Yeah.
Men are notoriously bad at coming to the doctors with these type of complaints. The current guidance is that men should be checking themselves at least once a month. It's really important to get any lumps checked out straight away so that we can arrive at a diagnosis and make sure it's not anything serious. Right, we'll have that stitch there, if you don't mind. It's off. I'm just going to put a few absorbable stitches in. I'll show it to you at the end if you want. We do a number of minor surgical procedures within the practice. Personally, I perform between 5 and 10 procedures per week, but the practice as a whole might do up to 30 procedures, which significantly takes the pressure off the local hospital. Thank you. There's 3 little stitches in, which will all drop out, OK? We won't put any sticky dressings in, but we'll give you some pads to put inside your underpants.
Right. Do you want to can you just manage to pull your underpants up onto this pad from it? Because we don't want to go sticking it to you. And you won't thank us for that, will you, when you have to take it off?
Do you want to see it, or you're not?
Yeah.
So it's quite a size. It's all fat in there. So we're going to send it off to the lab to get analysed. And then we'll write to you when we get the results, OK?
That's fine.
But I certainly don't think it's anything nasty. It's not a wart. Your doctor thought it was a wart, but it's not a wart. It's quite a common thing. So we'll pop it in and get it analysed for you. All right.
So that's fine.
All right. Any questions you want to ask?
No, thanks. Good job. Really good job, yeah, thank you. I like it.
No problem.
Thank you.
OK, we'll leave you to it then. All right, all the best.
Thank you,
OK,
bye-bye.
take care.
You too.
OK, look.
It's a reasonable size, wasn't it?
It was. I'm not a GP, but I wouldn't have said that when I walked.
I got beat up on my stag night.
My brother, he got attacked about 23 years ago. Luckily, he came round after about a week, but he had to have all his face rebuilt and everything.
I cut my throat in LGI and had to drill my head because my brain was bleeding.
Oh.
Come in. Hello, come in. Come and sit down. Are you better? How's his tongue?
A lot better.
Is it? Yeah. Good. I tell you what I'm worried about. It's the first time I've met Lucas, and he looks a little bit pale to me. It is unusual for young, healthy children to get these kind of infections.
Yeah.
Some things that might do that are things like diabetes, and also more serious conditions as well.
Yeah.
He has got thrush and he's got tonsillitis, so we need to treat that today. But I'd like to send him for some tests to look at his immune system, which is a blood test. I'll give you a form for it. Can I see your tongue? Oh, that is a nice, healthy tongue, isn't it?
Yeah.
Is that for me? Is that for me? Can I keep it? Hey? No, you can have it. Right, so when you came in last time, we had to think about why Lucas might be getting recurrent thrush, and we thought we'd do some tests to find out, because his diabetes test was normal, that was all fine. And we looked for things like his iron levels, and that was also fine. And we looked for lead levels, which we often do in children where we're worried about their immune system. Fine. What it has come back as, though, shows that Lucas is anemic. Now, when people hear anemia, they often think about iron and low iron levels, but there's lots of different types of anemia. And Lucas's iron levels are, like I say, perfectly normal. However, he's still anemic for some reason or other. So his red cell count is low. All his other tests have come back as OK, so I'm reasonably happy with them. And he's a well child, he's developing really well.
Oh, yeah, definitely.
So I'm not overly worried about it. And it may just be that Lucas runs at a lower level to other people, and that's just normal for him, and his body's just been like that since he was born. So if it's OK with you, I would like to refer him to see a paediatrician who can look into it in a bit more detail.
Yeah, that's fine.
They may just say to you, nothing to worry about, Dr. Khan's overkill, it's all fine. But I'd rather them say that than us miss something. Does that sound OK to you?
Yeah, that's fine,
What do you reckon, Lucas? Is that all right? What's wrong with your knee? Hey? What's wrong with it? Is it a bit sore? We'll make it better. How's that? So leave it with me. I'll do the referral.
Yeah.
You'll get the appointment within a week.
Right.
And then they'll just have a look at him, maybe do some further tests and
Yeah.
hopefully reassure us both that everything is
Lovely.
okay.
Yeah, no problems.
Okay,
All
that's
right
it.
then.
We're done.
Well done.
I got a
Is that
smile
it
this time.
Yeah.
That's a nice smile. It's nice to see you looking so well. Okay, thanks for coming in. I'm sorry to drag you in just for that, but I think it's important we talk face to face rather than anything else. All right.
Well,
Cheers.
thank you very much.
See you later. Bye-bye.
I finished those chipsticks off, but I think I might have to have a bit of chocolate again.
Delicious. A pomegranate speed food. Something that don't fill you and they don't usually taste that nice.
Got Ferreros.
Oh.
And strawberries. Look at this. It's like a proper feast.
Hello. Hi. Hi, have a seat. Hi, I'm Susan Towns. Hello. What can I do for you?
Well, I came in doctors about 2 weeks ago now with my, he gave me some sachets.
Yes, to help your bowels.
Yeah, but I'm still getting them constipations, so I don't know what to do.
Okay. When you say constipation, what do you mean exactly? How often do you have your bowels open and what does the poo look like? Sorry, I know it's a bit weird to talk about. How often do you have your bowels open? Is it every day, once a
Well,
week?
every day.
Every
well,
day? Most days?
Most days, yeah, but
Okay.
I'm struggling, you know, like...
But you're having to push and force it?
Yeah, at times, yeah.
Is it little balls or is it little balls all stuck together or what's it like? So Sam, I'm sorry, I know it's a bit embarrassing to talk about maybe.
Well, I don't know, it depends what I eat, you see, so, I mean, it's like like today I've been like going to the toilet a lot because I've had a few curries to eat last night.
Right, so it's
But
what,
again,
a bit loose or?
yeah, it was loose, but again, I'm having to like, you know, push it a bit.
Could I have another look at your tummy, please?
Yeah, cause.
Yeah, can I get you to lie on the couch? I'll pull the curtain round. I'll pull this round just... Oh, sorry.
Oh, sorry.
Just so that if anybody gets the wrong room, they won't. Okay. Any pain in your tummy at the moment?
No.
Okay, excuse me. Just tell me if I'm bothering you, won't you?
Yeah. A bit sort of there. I can feel something. Yeah.
There. And waterworks are okay, are they?
Yeah.
Am I hurting you there?
No.
No. Okay, that's fine. Let's do some blood tests, if that's okay, to check for inflammation in your body and in your bowel.
Right.
Would that be okay to look into it a little bit more?
Yeah.
Yeah. So, if you book your blood test at reception, please.
Thank you.
Thank you. Take care then.
Okay, no problem.
Thanks a lot.
See ya.
Bye for now.
You look so lovely. Very colourful today.
Well, not like him. I am liking that top.
Do you know, I quite took a bit of a shine when I was going for my little milk and bread.
Exactly.
I do love it. Oh, mind you, I love all your
Thank
outfits.
you.
Come in.
Thank you.
Hello, I'm here. Hello, hiya, Devon.
Hiya,
Come
you
in.
all right?
Yeah, good. What's happened to you?
Oh, I don't know. I went into hospital for shortness of breath. Then they did an echo.
I can see the result.
Yeah.
Yeah. So on there, do you mind if I put severe heart impairment, severe LV impairment?
Yeah.
Is that all right?
That's fine. What's happening is this foot's swollen. Now, yesterday, it almost went black.
Okay.
Until I put my foot up in the air. When I put my foot up in the air, it felt like around this area here, my blood had turned to acid and it was just burning. If I move my toe, it's ridiculously painful.
There's definitely no... I know it's a really obvious question. You haven't banged it, twisted it, anything like that?
I can't think of anything. Because at first, I thought, it feels like I've dropped something really heavy on this part of my foot. If I try and move my toe...
Yeah, let's try your toes first. So do that one first. Wiggle that one around. That's all right. And then do that one.
Wow.
And show me exactly where that pain comes on. under the ball there.
Yeah.
Okay. Does feel warm, doesn't it? Okay. Right, Devon. It's painful. It's warm. It's sore.
Gout again.
Well, it's one of the differentials, but the other thing we have to make sure it's not is an infected joint as well, because that would be more pain than your normal gout.
Well, this is more pain than my normal gout.
So we need to have a think about it. I don't think we can just put it down to gout because you're being very clear it doesn't feel like your normal gout.
Yeah, it doesn't feel like it.
That's not to say...
It's not?
It's not. It could be a worse kind.
I'm not a doctor.
I think we need to find out. Well, you know your body better than anyone else. And in here, I always say you're the boss, the patient is the boss, so we have to be guided by them. All right, I'm just going to check your temperature. The temperature's creeping up a little bit, though. It's 37.7. I think we might need to do some urgent blood tests on you today to look for both gout and signs of an infection. If it's gout, we can manage it here with medication. If it's an infection, we'd have to admit you to hospital for antibiotics through a drip. So I think if I get some bloods done now from you, we'll know by this afternoon what's going on and I can give you a phone call. Right, let me just go to the nurse's room and get a few bits and bobs.
All right, thank you.
I got a couple of areas of skin that were a bit odd, really.
A bit odd?
Got a lot of dryness in my head, a lot of flakes coming out.
My skin's going all flaky, it's itching.
Can you see this spot?
Yeah.
All around my face?
Yeah.
So this looks like infection, like what we call a cellulitis.
Her eczema started to flare up again.
It's seborrheic dermatitis, which, you know, in a lot of people it's just called dandruff, really.
That's lovely and smooth, isn't it? Yeah, that's really good.
This skin here is absolutely beautiful. And so you are doing a really, really good job.
Come in. Hiya.
Morning.
Hi.
Are you
Come
well?
and have a seat. I'm fine. Come and have a
Good.
seat. So, I'm Dr. Butterworth. What can I do for you? Right. OK.
I've run out of that stuff what I got
Right.
last time. It's helping, don't get me wrong, but it ain't getting the lumps away, which is more or less around the middle of that's around the middle kind of thing. All the rest is like dandruff, but it's scaly, but
So it is quite thick.
it's not getting rid of the lumps. I call them lumps, like I don't know what you call them, but... And I'm getting tending to pick them, you see, and I shouldn't do.
Are they really itchy?
Not really as such, no, it's just like a bad habit I've got now.
I think it's not just a bad habit, all right, because it is really thick and scaly there, so it's your psoriasis. Have you ever tried an oil, rubbing an oil into your hair to kind of
Don't
loosen?
like what you people have given me.
OK.
And I'm getting old, never mind getting old.
Happens to all of us.
It does,
What to
love. I'm up in May next year.
How old are you going to be? Ooh, you're going to be 75 next
but,
year. 3/4 of a century.
Free television licence.
All right. There's a silver lining to every cloud. OK, so what I'd like to give you some, it's like a coconut oil.
We've about 19 jars of that, all coconut
Have you?
oil.
OK.
Yeah.
When you use it, how are you using the oil? What do you do?
I just rub it in and then shampoo it off, love. I don't know.
Do you leave it on overnight?
No.
Maybe try leaving it on overnight, because what you need to do is get the oil to really soak into that really hard, dry scale. It's so thick, it needs time to soak through.
All right then, my love. Yeah, fried those.
Are you all right for your other creams, for your skin?
Yeah, A45 and all that, yeah. Or whatever else you've got. I don't know all of them. It's been that long since I've had it.
Whereabouts on your skin do you get the psoriasis?
Oh, that's on my legs, love. Not on my... That's on my legs.
Yeah.
But that's just born idle with me sometimes.
Right.
You know what I mean?
OK, so you need to
Well,
put
it's
your...
up to you, my love.
Well, you need to use your moisturiser.
Yeah.
How often are you using your moisturiser?
I are, that's only when it starts scratching.
OK,
Or itching, I should say.
Right.
And I shouldn't do. I know I should use it every day. I know, love. I do.
Yeah.
I know, love.
You need a bit of a poke. Actually, there's another one called Sebco. Let's see if Sebco will work for you. OK, so this is some more of the stuff for your scalp.
Yeah.
But I would use this... You need to use the coconut oil, leave it in, massage it in really well, leave it overnight, and then wash it off in the morning.
OK then, my sweet. Yep, fine, those off.
All right,
Right,
take care.
thanks a lot,
All
Dor,
right,
thank you.
bye then.
Which medical practice? Everybody speaking?
Okay, I've made note of that. Doctor will give you a call back.
Go, Debbie, go. Go, Debbie, go, Debbie, go.
Thanks, bye. I'm in hot flushes today.
Oh, yeah? I thought I had an heart attack yesterday. I don't know what's up. I had really bad chest pains and I went all dizzy and back of my neck hurt. Yeah. I was spent with nearly phoning me an ambulance.
Do you have a bottle of urine sample?
Yep, certainly.
Just a sharp scratch.
Yeah.
And then what are they doing about your heart at the hospital? What's the plan now?
Well, I'm just waiting for my meeting with the consultant, which is at the end of October. They've changed my medication a couple of times. I'm
Yeah.
on that Entresto.
Yeah, how are you finding that?
To be fair, I'm not noticing much of it.
No, fair dues. So, Devon, just persist with the pain for a few more hours. I will
Am I
phone
all right
you.
to take painkillers?
Yeah. What painkillers have you got?
I've got Cold-Coldamol at home.
Just take that for now. I'll call you the minute I get the results.
Brilliant.
If it's gout, it's just a really bad case of gout, we'll sort that out.
Yeah.
If it's an infection, I'll arrange for the team at the hospital to see you, because joint infections can be quite nasty. So we just need to make sure we're not missing anything like that. And with your temperature being borderline, you can never be so sure.
OK,
All right.
no problem. Well,
so
just let us know.
I will.
Thank you very much.
No worries, thanks for coming in. Where did you get the crutches from?
I used to keep getting swelling in my knee, and I kept going back to the hospital, and I kept bringing them back. And it was like, you're in and out of here so often, just keep them.
They're yours. It's a good job you did.
I was like, all right, fine, thank you.
Cheers, mate.
All right,
take
thanks.
care. Bye.
Bye.
Mr. Judson? Mr. Judson? Would you mind coming back up? Your appointment's not today, it's tomorrow.
Tomorrow?
Yeah.
Oh, never. Oh, I don't mind. I'll come back tomorrow.
OK, we'll see you then. Thank you.
Come in. Hello. Is it Prina?
It is, yeah.
Sorry to have kept you waiting. I'm Dr. Schefter. How can I help?
So I've just moved back from uni back home.
OK.
I have ulcerative colitis and I'm on repeat medication. So I just wanted to get the ball rolling with hospital appointments so I can get my medication again.
No, absolutely. So how's the ulcerative colitis been?
Remarkably, despite a really stressful year at uni, pretty under wraps.
OK,
seem to be managing it OK, and the azathioprine seems to be
doing the trick.
Working well, yeah.
Fab.
Ulcerative colitis is a condition that's long-term that causes inflammation of the colon and the rectum. It can include symptoms including diarrhoea with blood and with pus. It's often diagnosed in young people between the ages of 16 and 25.
Any issues with any of your medications at the minute?
No, none at all. They seem to be doing the job.
Great. And when did you have your last lot of blood tests?
The last lot will have been in June.
OK,
and then
great.
Came back fine, yeah.
And how often did you have them done?
Every 3 months.
Fab. Because that's what we'll be doing, and I'm pretty sure we can continue doing that.
OK.
So let's sort that out. And is it Pentasa?
Yes, I'm also on Pentasa.
And how often do you take that?
I'm meant to take... Oh, what have they put? Because I've
twice
been
daily.
a bit of a self-doctor and I've kind of not been taking it. And it seems to have been fine for me.
Ulcerative colitis has fits and starts, so to be honest, you are the expert when it comes to your condition.
It's not OK for patients to stop taking medications when they feel like it, because their conditions can flare up and they will feel worse. It's still advisable to speak to your GP about whether it's safe to stop taking a medication.
How many have you been taking?
I've not been taking any recently.
At all?
Yeah.
Shall we stick it on your repeats so you can get it when
if
you
I want to, yeah, that'd be good, please.
Do you need a prescription for either one of them at the moment?
I'd like one for azathioprine, yeah, that'd be good.
We've got those. If on the way out you could just book an appointment for some blood tests.
Yeah, sure.
That's for
very
you.
much. That's great.
Thanks.
Thank you.
Take care.
Bye.
See you soon. Bye.
Ridge Medical Practice, Megan speaking.
Good morning, the Ridge Medical Practice, Mandy speaking.
Hello.
Yeah, hi, it's Dr. James calling from surgery.
What's the problem?
Is he having a bath?
It's not a BP or looks infected or anything.
So he didn't have to go to hospital or anything?
Is it sort of like sharp pains?
And he's feeling short of breath?
No, that prescription's not for you, Dad, it's for you.
OK, bye.
Thank you. Bye.
Thank you, bye.
Oh, I think that one I've just rung, I think he'd had one too many.
Hiya, Devon. It's Dr. Khan from the Ridge Medical Practice. How are you doing? Still in pain? Yeah. OK. So I've got some good news and I've got some bad news. So we'll start with the good news, actually. It's not an infection, so you don't have to go to hospital. The bad news is that it is gout, but it's pretty bad gout. The test I sent off looks for something called uric acid crystals in your blood, and that's the stuff that collects in your joint spaces and causes gout. And yours is pretty high. Yeah. I'm going to give you something to help with it. Don't worry about that. But looking through your notes, you've had gout a few times, and we need to have a think about whether we give you something both to treat the pain now, but also another tablet to take daily to reduce the flare-ups of the gout. So I'm going to give you the indomethacin, just because we're limited with what we can give you for the gout with your heart. And then I'm going to start you on a tablet called allopurinol, which you take every day, and that should reduce the number of flare-ups of gout that you have. Yeah. So give me 10 minutes, it'll be ready for you at reception. All right, Devon, you'll feel better with the right... This is the right treatment, it just needs a bit of time. All right, cheers, mate. OK, take care. Thanks, bye-bye, bye.
Come in. Hello. Please come and have a seat. My name is Dr. Hag. Yeah. What can I do?
I'm first of all, I have a lot of breakdowns. I constantly feel like I just don't want to do anything. I don't want to wake up. I don't, I have a feeling of guilt and shame at the same time. Like it's just like a lot of emotions just going on inside.
And how long would you say has all this been going on for?
For a very long time, actually. But then, obviously, you have better days and you feel, well, it seems like I'm going to be much better.
Yeah.
But then it just comes tumbling down
and what
again.
made you come now, sort of, if it's been ongoing that long?
I'm a bit concerned now because I can say before she was born, when I was still a student and everything, when you're feeling like that, like you would self-medicate. I used to drink a lot, do you know what I mean? Chill with friends, smoke a lot.
Yeah.
But then now it's like you're dealing with everything sober-minded. It's like you can feel it more, and I'm just like really scared of like the dangers of it because I was self-harming before.
Okay.
So I just don't want to get to that point again.
Have you had any thoughts of self-harm during this time?
I have.
And what stops you from doing anything?
Her, yeah. She's really been my push most of the time.
Okay. Have you been on any tablets before?
No.
Never been on tablets?
Yeah.
Okay. Has anything recently happened that might have triggered it?
I think it's just loneliness nowadays, yeah.
Okay. Who else do you have at home with you?
Just me and her, yeah.
Just you and her. Okay. And are you working?
No.
And what about your sleep and appetite? How is that?
I don't eat at all. Like yesterday, I think I had like a bite of a chicken and that was it. So my eating has really gone downhill because I used to have that strength of like cooking for her and everything and I'll feel motivated and all of that. That's all gone out of the window now.
Okay.
And my sleeping, I don't sleep until like maybe 3, 4 a.m.
Okay.
Which makes it harder even to wake
And do you feel anxious as well, along with your mood being low?
Yeah, I'm constantly nervous for some reason. I don't know why. Like, there's just that anxiety in everything that I do.
Okay. Well, I'm glad that you've come to us. It is a big thing that you've come to us so that we can help you. It sounds like it's a long-standing thing and you've just been coping with it, but now that you're at this point that you really feel that you want something to help you, there's medications that we can give you that help with your depression. So that's an option. The other option is non-medication. That's like counselling and stuff, which will sort of is more long-term that we're looking at. What are your thoughts about trying a tablet?
To be honest, I'm open to any options, but then I think the most important that I would want to have is talking to someone because I just feel like I have a lot to let out.
Yeah, and I think, no, that's fine, that's absolutely fine. There we go. It's okay.
Sorry.
No, it's okay. Take your time. It's okay.
Whew, I don't even like her seeing me cry.
No, it's okay. Oh, you're watching the very hungry caterpillar. Watch. Is it hiding in the tree?
I had an irate patient this morning complain that she had breast pain, but she's got an implant, so it'll be that that's caused it. So take your implant out, but you'll get pregnant. It's not...
implant like implant. I think you meant implant like breast implant. I was like, what?
Hi, Sonia, come in. Won't be a second, let me get rid of this urine.
Oh, look at that colour.
I know, it's dark, innit? It's because she's very dehydrated, Sonia. This is why you need to drink water.
Poor thing.
Come in. Hiya. Hi. Hello. Are you Amara? Yeah. Do you want to come and sit down?
Nervous.
Oh dear. So what can I do for Amara?
I was washing her hair last night and I found a lump on top of her head. But while I were carrying her, we had complications at 33 weeks. I found fluid on her brain, so it's concerned me a bit.
Right, sure.
So
yeah.
I just wanted to get it checked out, really.
Of course, yeah. Has she done anything that you think might have caused it?
No, she hadn't had a bump. She's had a bump today.
Right.
But not on her head, on her eye, obviously.
Right then, shall we have a look at your head?
Yeah.
Let's have a look. There we go. Now then, so can you show me where you found it?
It's at the front, just there.
Okay, I'll just have a feel at the back as well. Okay, I'll let you put the things together. So, in terms of fluid on the brain, you would never get changes on the skull like that from fluid on the brain, okay? Because what happens once kids get to a few months old, then they've got these soft spots on their skull. Yeah. And those close over as they get older. Right. Usually by the time they're 1 year, she wouldn't have any soft spots left, and she doesn't have any soft spots left, and that's fine. So that means that as kids get beyond the age of 1, if there's fluid on the brain, what you notice is that they start to complain of feeling poorly, they start to vomit, and they're just generally really unwell. But they wouldn't get any change in the bone, they wouldn't get any lumps in the head, because it's like a fixed casing, all right? So she's definitely not got any symptoms that are suggestive of a fluid in the brain. Right, okay. What I can feel and what you felt is sort of bony ridges. So where they call them the sutures, where the different plates of the skull are. Yeah, yeah. I can feel that those are a bit raised. And normally speaking, we wouldn't worry about that at all. Right, okay. All right? Yeah. So I suspect it's been like that forever. Right. All right, and it's just that you've just not noticed it. Right, okay. Yeah. I don't think we need to do anything about this. Right, okay. I will do a little bit of reading just to see do we need to do an X-ray or not. I think not, but I will read up about it and I'll give you a call. Yeah, that's fine. If we need to do anything. Right, okay. All right? Yeah. But the key thing is that she's well in herself. Yeah. And she's happy and playing. And if she's like that, then we don't worry. Yeah. All right.
So thank you. Bye.
She's gone shy. All right, take care. Bye then.
What I'll do is that let's start you on a tablet, something that's called sertraline. I'll start you on that because it works for anxiety as well as works for the mood bit as well. We start off on a low dose and gradually build it up. So what I would like to do is that give you the tablets and see you back in about 3 weeks' time. Okay. If it's not making much of a difference, we increase the dose, but we do it on a gradual basis. Is that okay? Yeah. So I'll do that for you, and then I'm going to give you a leaflet which has got some numbers on it, which you can contact. That's for counselling. Just print that off. So this tablet, usually people tolerate it well, but it can make you feel a bit sleepy, and it can also cause some problems with the stomach, so like indigestion or heartburn. Most of the time things settle down, but if it doesn't, let us know. So that's the number first response. That's like a crisis number. They're a 24-hour service. So, like, you know, if you felt really low and depressed and you were unable to cope with things, you can ring them up. They will talk to you and they will go through things with you. So just like, is that okay?
Okay, that's fine.
Then that's your tablet. So that's your tablet. So sertraline 50 milligrams, one tablet once a day. And then let's see you back in about 3 weeks' time, just before your tablets run out.
All right.
Is that okay?
Yeah, that's fine.
Anything that you want to ask?
No, I think that's okay, really. Yeah.
Yeah.
Thank you very much.
You're welcome.
I appreciate it.
I'll get the door for you. Okay then. Bye-bye.
Thank you.
What? I love the taste of that envelope.
Come in. Hi,
Morning.
Mr. Conway.
You
Come
all
in.
right?
I'm Dr. Khan. Yes, I'm good. Thanks. Come take a seat. How can I help?
So, go to the gym, and I think it's been done at the gym.
Okay.
I've got quite a bit of. It's not going away. It's basically pain through my forearm and my tendons. I
Okay.
think it's my tendons.
Yeah.
I'm not the doctor.
We'll have a look.
So basically, I just want to have a nose at it so I can see.
Of course. Any numbness in your fingers at all?
No.
Nothing like that. You don't wake up in the middle of the night having to shake out any kind of
No.
numbness? Nothing. Okay. Shall we have a look? So if you show me where you get...
So it can vary. It's kind of like up there.
Yeah.
But I'll also get it
Around
like
there
here
as well.
and down my thumb.
Okay. Just push your thumb back against my finger. Does that cause any pain anywhere? Yeah.
Yeah, so that's hurting down here.
Yeah. And I'm just going to follow this tendon now. Just keep your thumb pressed up.
Just keep pushing.
Yeah. How does that feel? Along
Feels
there.
all right with your fingers. It's hurting
Sting.
there.
Yeah. So it does feel very much like the tendons have been pulled and stretched on there. So there's a few things that we can do for this. There's different kind of levels of treatment for this. Tendinitis is inflammation of the tendons, it's usually from pulling or pushing of the tendons. First is rest, if we can, and it can take 2 to 4 weeks for it to settle down. And I know when you go to the gym, 2 to 4 weeks is like a lifetime, isn't it, of rest. Physiotherapy is something that helps. We have physio sessions here that you can come to on a Wednesday lunchtime. You can just drop in and you get seen by the physio without an appointment.
Right.
Anti-inflammatory medication is the next line. And people often think taking them for pain is the way forward and you take it when you get the pain. But with inflammation like this, taking it regular will reduce the inflammation down. So 2 or 3 times a day with the tablets or the gel regularly for a week, and that should reduce that inflammation down. Rest it at the same time.
Yeah.
Does that sound all right to you? Yeah.
So when we say rest, is there anything I can get away with in the gym?
You can use your shoulders, your chest you can use, but the problem with your chest is when you're doing that exercise, you've pushed your wrist back and you're pressing against it. You're just going to have to work out your legs and end up with massive thighs. You could be like the new Nicki Minaj.
Is that the goal, right?
That's the goal.
Rested tendon, Nicki Minaj.
Nicki Minaj below, someone else on top.
That's what we'll go for then.
We'll do that then. Is that all right?
That's perfect.
Any problems, come back and we'll have a rethink.
Thank you.
All right.
Smashing. Thank you very much.
All right, Richard. Nice
All
to
right.
see you.
Yeah, you too.
All right. Take care.
Good day.
Bye-bye.
Take care.
I wouldn't worry about it. All right, no worries. See you later.
Here, I'll open the door for you.
Oh, who said chivalry is better, actually?
All right, darling. I'll see you next time.
All right.
All right, mate. Take care. See you then.
Good morning, the Ridge Medical Practice. Vicky speaking.
I'm going to be honest with you. I am smoking weed. I know it's not the right thing to do.
When I was a kid, it was really bad because she got it.
Yeah.
It makes me feel ashamed, you know.
Don't feel ashamed.
It wasn't empty that time, was it?
No, you're an awful girl.
Which bit do you think you find the hardest?
Everything. You just want everything to go away.
At my age, you know, you can't leave things too long in case you pop off in the meantime.
Hi, Ebony.
Hi.
Right now. Come and take a seat, please. How can I help?
I've come because I've tried to get rid of thrush on my tongue.
On your tongue?
Yeah, I've bought stuff over the counter and I've tried multiple different things and nothing's working. And I even went to a clinic because I thought it was like an STD, but they said it's not.
So it's good that you've been to a clinic?
Yeah.
That's good.
But it was embarrassing that it actually wasn't.
How long have you had the thrush on the mouth?
Months, like 6 months.
6 months?
Something like that. I've been trying all sorts of different stuff.
6 months is a long time.
What causes it?
There could be a lot of different things, actually, why you get it.
I've read that mouthwash were bad, which I was quite surprised by.
Sorry?
Mouthwash,
Yeah.
I'm using too much, and I do use a lot of mouthwash, so
All right. It can be also related to other things, like if your immune system's down, or like things like diabetes as well.
No, both of them aren't in the question, I don't think. So if it's not an STD, you can't catch it off people?
Here we are.
Thank you.
Now then, so if you come in and have a seat, and this is Rabia.
Hi, Rabia.
Who's our student today. So hello again, Mrs. McElvenney.
Hi, Doctor.
And you've come back to tell me what's happened with your ear.
It's not as bad as it was, but there is still tenderness there and there was some dry skin.
Okay.
And the other thing was the one on the chest. I knocked it off cleaning myself and it bled. You know, you said to keep your eye, and there was blood.
Any other bits concerned you at all?
Well, no, you did. I mean, I do have some more that I'm not happy about, but I think it would need a complete overhaul to look at all my skin. There's lots, but probably not today.
Start it with the ones that are troublesome, shall we? And it's your right ear.
It is.
Find the troublesome bit for me. Yep. And it's almost gone. It is tiny. It's a lot better than it was. Do you mind if Rabia has a little look?
No, carry on.
There's just this, see the little tiny area of thickening there? You can just about feel it. But when we started, it was much larger and thicker and scalier.
And there was need to have half my ear off.
You've still got your whole ear, so you have. Can I have a little look at the other bit?
I'll just need to
find
feel
it for me.
Yeah.
Just at this bit here.
Yeah.
That's absolutely fine, though. Okay. There's no sign of any worrying features there. No sign of any early skin cancer. You've still got a little bit there, so I do think another squirt with the liquid nitrogen might be of help.
The last time, your bottle must have been empty, James Bond.
Surely not. I've just been to fill it just now, so there's definitely some in today. So this is called cryotherapy. We decant a little bit of liquid nitrogen into this. It's very cold.
This is why I call her James Bond when she's on this in her hand.
Oh, you make me feel swell-headed, you will, really. Look, there's definitely some in. Yes? 3, 2, 1. It wasn't empty that time, was it?
No, you're an awful girl.
Terrible. I do apologise, but you know what we're trying to do, even though it's taking a while, is to avoid us having to cut any bits out of your ear.
Yeah.
You don't want a nick out
I
of your
don't want
ear.
to be a Van Gogh, do I?
No. There's very little left of it, though, so I'm hoping very much that that'll be the last time.
Yeah, you said that 3 times ago.
Yeah. Well, I'm an optimist, that's what it is.
Really got better, hasn't it?
But that was a proper squirt this time, wasn't it?
You're getting your own back on me.
So I'd like you just to leave it alone.
Yeah.
But I'll still need to check again. About 6 weeks?
Yeah, that's great.
Thank you very much for your
Thank you,
patience.
Doctor,
Thank
yeah.
you.
Thanks.
Bye now.
Bye.
Thank you.
Bye-bye.
It's not a thing that you normally would catch, thrush on the mouth. Have you been in contact with anybody with?
No, I think you'd notice if they had a white tongue.
So have you had a full checkup as well?
Yeah, everything's
including like HIV.
Yeah,
and
everything.
Everything's clear.
Yeah. I go regularly, so I'll be getting a text again soon.
Oh, that's good then. Let's have a look. And
It's quite sore as well.
Does it feel sore?
Yeah, it depends what I'm eating, but it's obviously damaging the surface of my tongue, whatever it is.
And is it painful when you
No,
swallow
not
it
really,
at all?
no. There's
You
no
don't feel
pain,
like
it's
food
spicy food makes it worse.
So we'll give you a tablet, okay?
Right.
To take. And you need to take it for a couple of weeks. You're not allergic to anything, are you?
No. Should it start to show signs of clearing up? How quickly?
You should be able to see some difference within 72 hours.
Right.
And also, if you can just arrange to have a blood test done.
Yeah.
We'll just check you for anemia and just check for diabetes as well, OK? And hopefully by that time, things should have cleared up.
Yeah.
If it hasn't, we can give this treatment for a bit longer as well,
Right.
OK?
What are the side effects on it? Am I going to get any?
Well, there's always side effects to medication, but...
chances of them bad?
No, but which side effects are you worried about?
Like nausea and stuff.
Yeah, you can get...
Fatigue, because there's common, there's really common.
Yeah. So you can get nausea with most medications, OK? Try the medication first, OK? If you get side effects that you really can't cope with, come back and then we'll have a chat again.
Right.
All right? Book for a blood test at the front desk and we'll see you in 2 weeks' time.
All right, that's
okay?
great. Thanks.
Thanks. See you later.
See ya. Is it this way, yeah?
Yeah, that way, yeah. So, what if I got you an appointment today? Would that be okay?
Unless it's this afternoon, I can't come this morning.
See what I can do, Dorothy, okay?
Thank you, love. I'm out of breath.
Do you want some water?
No, I don't drink water. That's for wimps. I drink wine.
Morning, Leah. Who have you brought with you today? And how can I help?
Aye, she got sent home from school on Tuesday with headache, feeling sick, not well. I was going to send her today. She's still crying with headache and belly pains. I thought, well, let's bring her to the doctors.
And are we eating and drinking, or...?
Not really, not for her. She can eat a lot.
Can she?
Yeah.
All right, so this all started Tuesday, a couple of days ago.
She's told me she's not really weeing much either.
Right, OK. Is that because you're not particularly drinking much, do you think, or...?
Because on a Tuesday I do a bit of voluntary work with old people. Old people. You'd think I were young, wouldn't you?
You look good for 43, don't you?
You're not?
No, I'm not.
Oh, goodness sake!
46, it's no, is it? It's like, it's me.
I could have been your mother.
My mum's 64. Is she?
It's pretty stupid, 64-year-old getting bikes again. You sound very young, 71.
You really don't look 88.
What time when they walk through the door, she'd be stripped down, touching toes, and she was in the 90s.
Getting strappy in my old age.
He said he's just met somebody 107.
You look exhausted. How can I help?
I've got a bad cough.
OK.
And it's keeping me awake at night. And I'm not too bad with this through the day, but when I lay down,
OK.
and I'm just worn out because I'm not sleeping.
No, of course, yeah.
You know, so I thought I'd better just check it out.
Yes.
At my age, you know, you can't leave things too long in case you pop off in the
OK, let me have a little look at you.
Do you want me to take my coat off?
Please.
Which arm do you want?
Your left one, if that's OK.
I wanted to ask you as well, with going to the toilet so much, you know I've got a stent in, don't you?
OK, yeah.
I don't want to stop going, obviously, because, you know, I don't want a blockage or anything.
Yeah.
Over a course of a night and a day, I go about 8 times.
OK, I understand.
And it's weakening me.
OK, we'll have a look at that, all right.
All right, love.
That's on the low end of normal. I'll see how that is for you. It's not too low.
Well, I mean, I am 92 after all, so what can you expect?
And you're still with us, so that's nice, isn't it?
Yeah.
Right then, can you take a deep breath for me? OK, good. Right then, let's have a listen. OK. There's a little patch of crackly noises in your chest, so I think you need a course of antibiotics to make that better.
What does the crackling mean?
That you've got a chest infection.
Oh.
Little popping noises.
But will I live a bit longer?
I hope so. How long would you like to live?
Not much longer.
Oh dear, really? Do you think you might get to 100 and get your letter from the Queen? What do you think?
No, thanks. I don't want to live to be 100.
Well, that's only 8 years away. Isn't it? That's not too long. This problem that you've mentioned to me about your bowels, that's not just with this coughing, that's been going on longer.
Oh, yes, it's been going on quite a while.
Right,
yeah.
all right.
Yeah. taking a bit of something to cool me off a bit, you know, with my bowels.
Yes, I'm giving that some thought.
But for goodness sake, don't stop me going, will you? Because I've a horror of not being able to go.
I'm going to just ask a colleague or look in the medicines book. I just want to check that if we give you something like Imodium, it wouldn't bung you up. I will come back to you in just a second. Okay.
Yeah, okay.
So it sounds like you might have a bit of a bug going on, doesn't it, if you've got the diarrhoea. So you haven't been sick, but you feel sick? Yeah. So do you like school? No. OK, so that's not showing any infection or anything, it just shows us what we know, that you haven't had enough to drink, really. I need to have a listen to your heart and things in your chest, all right? So we'll need to take your top half off. Do you want to come behind the curtain while we do that? Yeah? Come on, then. Are you coming round, Mum?
No, she'll be all right.
Do you want your mum? No?
At first I thought my tummy hurt for my periods at first.
You what, lovey?
I thought my tummy hurt for my period, but then...
But then it felt a bit different. So it's a bit all over, is the pain, is it? Yeah. Does it feel a bit better when you've had a poo? Yeah. All right, I'm just going to have a little feel, OK? There's no worse area that feels worse than any others?
No.
No, it's just all over?
Yeah.
Yeah? All right, lovely, let's get you up. I think with the symptoms that she's having, it's a bit of a bug, a bit of a virus that she's got at the moment that's giving her this diarrhoea and everything, OK? From a school point of view, they don't want children that coming in when they've got diarrhoea, and you need to give it at least 48 hours.
Right, well, break up tomorrow, so...
Oh, do they? Right,
Yeah.
OK. But what we do need to do is have lots of fluids, probably
Right.
still drinks rather than fizzy drinks as well,
Yeah.
OK? Do you think you could try something to eat?
I'll try.
Yeah. Just go for something really plain, like a cracker or a digestive biscuit or a piece of toast, you know, something like that. If any of that tails off, so you're not, you know, you're not being able to eat or drink, or you're not drinking, and you know things about if you develop a rash anywhere, anything like that, you're concerned, she must be seen again.
Yeah.
All right.
All right, cheers.
You take care now. See you
Cheers.
later.
See you
Bye-bye.
Her hair's gorgeous, isn't it?
Look at this.
You like it, you want
like
to
a
play
pony.
with it.
It's
don't
like
you?
a pony. And does it want to look like with blonde hair? I might dye it.
Go to the mirror. No, put a fringe on.
Hello. My name's Caris.
What, are you trying to say I look like that?
No.
OK, I've checked with Dr Eunice, and she thinks that loperamide, which is Imodium, will be good. So we'll start with a low dose.
Low dose.
OK, just get to the right level so that it's making the symptoms more manageable for you.
Yeah, OK. Now, one little thing I wanted to ask you, they've sent me about the flu jab.
Yeah.
Have I to have it?
I'm quite happy to give it to you today, if you like.
Today?
Yep, you don't have a high temperature, so you're fine to have the flu
But
vaccine
won't
if you
it
want.
affect me with having a bad chest?
No, if your temperature's normal, then we can give you your flu
I might
vaccine.
as well have it then and get done with.
Yep.
Save me coming down
Coming back.
again, won't it? Yeah, smashing.
You're not allergic to eggs?
No, not that I know
Not
of,
that you
no.
know of, no. Fine. Right then, here we go. This one. Is that all right to put it in this one?
Yeah.
There we are.
I wish all things were as nice as that. 2 minutes, well, half a minute and it's done. Smashing. Right, have you done with me then?
I think I'm done with you now. Yeah.
Right.
So common side effects, I'm sure you're familiar with all of this. Muscle pain, headache, fatigue, slight tenderness on that arm. That's really normal. Only lasts a day or two at the tops usually.
Right, thank you very much for all your help. Very nice of you.
Bye-bye now.
I don't want to be awful, but I hope I don't see you.
Yeah, all right then.
Which way do I go?
That way.
Oh, this way, thank you.
Okay, bye.
Bye.
Come on in then. Do you want to take a seat for me, Charlotte? So, burning question is, when did you last smoke a cigarette?
Is it 2 weeks or is it over now? But I've just had a really stressful weekend, so I have been smoking.
OK, so we'll do your carbon monoxide reading.
Oh, I'm going to cry in a minute.
That's it, keep blowing.
Oh, I'm waiting for it to go up.
What's it reading?
22. It's come down a tiny bit.
Yeah. Have you been smoke-free for 2 weeks?
2 weeks, yeah.
Well done.
Oh my God.
Right.
I'm proper, like, I can't. I'm so excited to blow into that. Honestly, I am. I'm just like, oh my God. I'm proper nervous, like I'm starting to shake.
What are you expecting it to be on that chart today?
Well, ideally, in the green zone.
Yeah. So, shall we?
If not, I'm going to be disappointed.
Okay. Let's do...
What do you think it might be then?
I think if you've not smoked since your last appointment, it's going to definitely be that of a non-smoker. I mean, there are varying reasons why, but let's do it and find out.
I'm proper like on the edge.
Okay.
Oh gosh.
I'd like you to take in a really big deep breath. So breathe in, hold that breath, and just a small blow. So that's it. As fine as that, Charlotte.
Oh my God. 7.
Okay.
It's on 7. So.
Okay. I know you're going to ask me why is it not a 0 or a 1.
No, I'm happy with that.
Good.
I'm happy it's not in the like 20s.
I mean, it's nothing I'm concerned about, and I don't think it's anything for you to be concerned about. I'd just like to really congratulate you for it.
Oh God, I'm so happy.
Well
I'm going to
done.
celebrate. I mean, I don't know what I'm going to do later, but I'm going to celebrate.
Have a lozenge.
I know. I've got them in my bag now. I want to get to 0 though. Is even a 0? What I'll have to do is I'll have to
I've never seen anybody blow a 0 on that machine.
Really?
Yeah.
That's my goal then, to blow 0.
Okay.
I'll have to come with a
You'll
mask
have to
on
do it
next
as well,
time.
won't you? I know you will.
I will.
So I'll see you in 2 weeks, won't I? Oh,
my legs are killing. Oh, I'm so happy. Honestly, God, I'm really
pleased for you.
Hi, Mr. Woolley. Come
Hi.
in. Where's Mrs. Woolley?
She's...
Oh, she's over there.
Yeah, she's over there.
Hi, Mrs. Woolley.
Hi, love.
You all right?
She's saying, how do we cope? I said, you have to cope to it.
Come in.
Thanks, Dr. Khan.
No worries. Nice to see you both.
Yeah.
I like your top.
Thank you.
Right, so I've got the letter from the hospital. I think they've spoken to you about things as well.
We went to see them, yeah.
Yeah, so tell me what your understanding of everything is.
It told me it was something like a rogue growth. It's a form of skin cancer, but I don't know how far it's gone into my eye.
What they've said is that you've got something called a basal cell carcinoma, which in the initial stages can be dealt with quite easily with just taking it off. It is a type of skin cancer, but it's not a malignant type of skin cancer.
That's what they told me,
And the reason it's not malignant is that it doesn't spread off, shoot off to different parts of the
body.
body.
Yeah, that's what they said.
Yeah. So they are going to take off quite a large part because we have to get a good margin of normal skin as well around it. And it's reconstructive surgery that they're going to do, which is likely to involve a skin graft.
Okay,
Do you know what that means?
Well, take a piece of skin from somewhere, don't the doctor?
Usually the most common areas are around your buttock area. And because it's quite a large area here, they will graft that skin onto your skin around your face and try and get it to look, and they're fantastic. The plastic surgeons are absolutely great. You know, try and get rid of that. How are you feeling about it all?
It's depressing.
Yeah,
it's
I bet it
depressing,
is.
Because
it's important that I understand how you're feeling about everything that's going on.
I think he has been feeling a bit down. I think he has. Yeah, a lot. I know he
How
has.
down?
Down.
I know he has.
So down. I know you've got a lot of family support, but do you ever feel so down that you wish you weren't here?
Dead.
Right. How often does that happen?
Quite often.
Does it?
Yeah.
Oh, I feel so sick.
Can't eat a burger, I'll be sick.
You're right. No.
I'm going to be off sick tomorrow.
I'm feeling vomity.
So is he vomiting?
Yeah. Can I have a sick bowl, please?
I can't stop throwing up. I am so ill in the morning, but I think I'm pregnant.
Is she being sick or is it the other end?
I'm going to throw up, I know it.
Oh.
Now, this sounds like a bit of a funny question, but it's just something we have to ask. Have you ever made any plans to do anything or nothing like that?
Never.
Okay.
No, it's just, it pops into my head. You know, that you just want everything to go away.
Yeah.
Yeah.
You know,
Yeah.
it's so hard.
Yeah. I can imagine. I mean, I just see you briefly every now and again, and I can see that you're struggling in those few minutes that I see you
So
for.
hard.
Yeah. Which bit do you think you find the hardest?
It's just everything. You know, I've been hit with so much.
You really have.
Diabetes, epilepsy, skin cancer.
Yeah.
You know, it's enough to get you down, Dr. Karen.
Does it help to talk about it, do you think?
I do talk to Joan.
Yeah.
But she's had hot problems.
Are you okay? When you're suffering from one chronic illness, it's bad. When you're suffering from a list of chronic illnesses and you're in pain as well, you know, it's hard for people who don't go through it to understand that because it's constant. There's no break from it, and I think that's the.
I just want it to go away.
Yeah. We know you're on antidepressants. No tablet's going to take all this away, as you know. But if sometimes we add in another antidepressant to work in a different way to the fluoxetine, so you're taking it in addition to try and help you.
Click me out of it.
Well, yeah, it won't do anything by magic, but it might just lift you to that point where you're not feeling like you wish you weren't here every day, you know, and I think that's where we need to aim for.
Yeah.
I'm going to book you an appointment with our counsellor based here.
Yeah, brilliant, yeah.
And they're longer appointments, and she'll book your follow-up and just tell her exactly how you're feeling, you know, don't hold back, because you might be surprised yourself about how you're feeling and how low you might be feeling, and she can give you some advice. Is that all right?
Yeah.
Thank you, Dr.
My
Karen.
pleasure. Honestly, you can come and talk to me whenever you want. If you haven't got an appointment, just rock up at the desk and I'll squeeze you in.
Will you?
Yeah, I will.
Oh,
all right, so
you,
don't
Dr.
stress
Karen.
about appointments and all of that.
No, I'm just...
You're all right.
Yeah, I'm there. I'm getting there. Just, you have to do, aren't you, to stay strong.
You know.
And the good news is he's going to be a granddad again.
Ah, very nice.
After 16 years.
Oh, that'll book you
She's coming at Christmas.
Too much
think you got your hands full now?
Yeah.
Too much money, mate.
Thank you very much,
Right,
Dr.
cheers.
Dr. Karen, once again, mate.
My
Thank
pleasure.
you.
Honestly,
Thank you.
anytime, just rock
Okay.
up, I'll see you.
Right.
All right.
Thanks, Dr.
Cheers.
Thank you,
Take
Dr.
care.
Karen.
Bye-bye.
Bye.
Can't stop yawning.
Hi. Oh, there we go. A roommate.
Yes.
Hi.
Hello. Hiya. Come in here, please. Sorry for waiting.
It's all right. We're nearly falling asleep.
Did you?
Nearly. No, I just came straight from work, so.
I've got a medical student
Yeah,
with
no,
me,
it's
if
not
that's
fine.
all
It's
right.
fine. Yeah.
What can I do for you?
Basically, I'm in a lot of pain. And to tell you that, I'm going to be honest with you. I am smoking weed because of the pain, and it does dull it a bit. I've been taking, is it gabapentin?
Gabapentin,
Yeah, I had some of them left from before. Now, they do help if I take them constantly,
Yes.
but they don't take it away fully.
No. Pain is so bad that you had to rely on weed, you said.
Yeah, I know
Gosh.
it's not the right thing to do.
Did you see that Lenny Henry thing last night? That's that Lenny Henry thing on BBC One. Look, no Lenny Henry, don't you?
There's a black guy in here and I should know who he is.
No, that's so scared.
I don't even know what Malcolm X did. So about
He
Malcolm X.
had a dream. No, that's Martin Luther King.
Malcolm X did.
He was the Black Power.
Did he do Ready Steady Cook?
No.
Who? Martin Luther King? What were you on about?
When did it first start?
Carpal tunnel.
When did you have carpal tunnel then?
Well, I had the operation about 2-3 years ago.
I see. Okay.
And I haven't been pain-free since. This, I mean, you know, and what's with the pins and needles?
We'll come to that. I think
Okay.
let's take one
Okay.
at a time, because otherwise
Sorry,
we're gonna
I'm tired. I just want to go home. I do apologise.
Yeah.
Can I just show you?
Yeah.
It's always there in this area.
And while I'm here, I'm just going to examine your neck. It's not too bad, is it?
No, that's not too bad.
Okay. So it's more here.
Yeah.
Okay.
You're right on it, actually.
yeah. I can feel, the muscles are a bit tense.
I work in a kitchen. Now, I stopped that job because of this.
Gosh.
I don't want to smoke weed all the time either.
I see. Can I see your hands, please?
Okay.
What did you feel?
Like shock.
Where? Do you feel it now?
Yeah. There.
Whereabouts?
Yeah, there, yeah.
Here?
Yeah.
Okay, I see. Okay. Let's examine your toes, should we?
Oh, I will have very smelly feet.
Okay. Close your eyes, please, for me. Do you feel me touching you?
Yeah.
Now?
No.
Now?
No.
Now?
Yes.
Now?
Yes.
Now?
Yes.
Yes. Keep your eyes closed. Do you feel me touching you now?
No.
Now?
Yes.
Now?
Yes.
That's fine. You can open your eyes and...
I thought you were going to massage my feet.
You felt like that?
I was really relaxed then.
So, my feeling is that you have carpal tunnel syndrome on the left side, but not on the right side.
Yeah.
The reason for pain here and the reason for pain is probably different. So what I'm going to suggest is from 4 to 5 tablets a day, let's increase that to 6 tablets a day, 3 times a day.
Yeah.
And I think when you're doing that, you wouldn't need to rely on anything else for pain.
That's why I've come to you.
If pain is still an issue, I think I would like to see you. There is still a potential to add other medications and maybe increase the dose. So we've got a lot of things in our pocket. Options here.
Yeah.
Let's stick with gabapentin for time being and do that. You don't seem to have any loss of sensation in your toes. So I think in the first place, what I would like to do is, I would like to do some blood tests. When the tests are done, I would like to see you maybe a week after that.
Yeah, that's no
then
problem.
Decide what we need to do. Don't worry, we'll sort it.
Yeah. No, well, I kept moaning at my partner and he suggested the cigarette, but it's not you can't keep doing it.
No, you're right. You know it.
Yeah. Right, thank you very much.
Most welcome. You look after yourself.
I will do.
Thanks.
Bye.
Bye.
Anita, hi, come on in, my love, have a seat. And Dr. McFadden, what can I do for you?
I took myself to the hospital on Friday. Kidney stones.
Oh no, who are you?
But I thought it would have passed, but it hasn't. I'll give you the letter that they've
Good woman, we haven't got that yet.
Well, it's just what medication I'm on, and then it's something about reviewing at the doctor's.
Oh, well done for bringing that in, good on you. Oh, gosh. All right, darling. So you're going to have the further investigations and you've been given some medication.
Please, but is there anything different that I could have, or...?
Oh, this is the best
Do you
by
know
far.
when you just got the niggly pain?
Touch wood, I'm going to say no, and I'm going to touch everything here because I've never had kidney stones and I do not want them because I hear that they are grim.
Yeah.
Can I check your temperature for you today, my love? I mean, what we could do, you know, those naproxen, are you taking one or are you taking 2 at a time?
One.
You can
Tell me to take one of each.
You can take 2.
Of these ones?
Of the naproxen, yeah. You can take a dose of 500 3 times a day. Your temperature's okay, so that's good. It's not going anywhere. So you can double that dose. What I'll do is I'll do you another prescription just so that if you do run out, you have another one, okay? And Anita, look after yourself. This is rubbish.
It's horrendous, man. I won't wish it on my worst enemy.
Yeah, people say it's worse than childbirth.
Yeah,
Yeah,
it is.
yeah.
It is.
I
was at work as well, and I had to...
When was your last day at work?
It was Saturday.
You went on Saturday?
Yeah.
Oh my God, Anita, you're a hero. So basically, if you don't feel well enough for work, you self-certify for a week. So if you're not able to go in next week, give us a wee bell. Look after yourself. And as I say, if you need a sick note towards the end of this week for next week, will you let us know?
Yeah, I will do, love.
All right.
Thank you.
You take care. Hope you feel better soon.
Thank you.
Bye, Anita. Bye.
Hi, Mr. Sheffield. Hi, Dr. Card. Nice to see you. Hiya. Nice to see you. Come and sit down. Right, got you down for, well, it says toenails, so we're going to do one today and one at another time, is that about right?
Yeah, practically, yeah.
Okay.
But they're both dead.
Which one is worse?
That one. Dog keeps standing on it, it's like mad.
The dog keeps standing on it?
Yeah.
All right, let's have a look at it.
It's like it's got fungus.
Well, it's probably not even an ingrown toenail anymore. I think that is just a complete fungal nail infection. Shall I take the whole thing off?
Oh, aye.
Yeah.
Definitely take the whole thing off.
Okay, so I'm going to change this to a total excision rather than a wedge excision. Do you want to be sitting up or do you want to be lying flat?
I want to go to sleep.
It just depends on whether you want to be able to see anything or not.
No, go on. Attack.
Attack. You're going to look up at the ceiling?
Yeah. That's a big needle.
This is just to draw up, don't worry. You get a smaller needle. Oh. I'm feeling kind today.
You got the day off today?
I booked it off just for this.
Did you?
Yeah.
You're going to feel a sharp scratch now. Here we go.
You okay?
Ouch.
Okay, and then we're going to do the same on the other side. This is the worst bit now. Here we go. Sorry.
Ah!
Okay.
Ah!
How's your dating going?
Her mum loves me, I swear to God. She said she'll have another girl for me if none of her girls agree to marry me.
So how did you meet then? Were it like you?
At uni, yeah.
Oh, wow.
We got married in June.
You have a good do?
Yeah, we're good.
Been married 12 years this year.
I get married in 3 weeks.
Do you?
Yeah.
Wow.
So tell us how you propose.
It was in a restaurant, actually.
Oh. Bended knee?
Yeah.
Did
Oh,
you?
brilliant.
No, I won't bend it. Yeah, we're going to do that.
He's married to one that moves women.
Is he?
Yeah.
I think Debbie's nicer. You know why I say that? So I'm married to Debbie.
Aren't you lovely though?
Right, let's see how it's getting on. I'm just going to test it. Tell me what this feels like.
Feel that?
I can feel that.
Yeah, we'll give it a bit more time. So how did you meet, the two of you?
We knew each other when we were 10.
Really?
Yeah.
So when did you get together? How old were you when you got together?
4.5 years ago.
Really? So what happened in between?
I've been married twice since before I met Julie.
And obviously I got married and had a family. And then found each other on Facebook, wasn't it? He proposed to me when he was, what, 13?
Really? There's nothing like a childhood sweetheart. You never really get past that. Right, we'll get started. If there's any problems, let us know. Just shout, or you can punch Lynn. That's fine. Either or, whatever you prefer. So I'm just going to see how far your nail comes off on its own, first of all. Yeah, you're right. It's fairly loose, isn't it?
Yeah.
Okay.
Yeah, make it quick. Ow.
You're right.
Yeah.
Did you feel that?
I did.
Yeah. How does that feel?
Mm-hmm.
Okay. So what we have to do with fungal nail infections, because the nails get really thick, is just separate it out from the skin, because it does attach to the skin quite tightly.
Much blood coming out there then?
A little bit of blood. That's normal. We are taking a nail off, so a little bit of blood is okay.
Carry on.
Thanks. Here we go. It's about to come off. There we go. A little souvenir for you and your induction. No? Right, Whitney, if you just put a bit of pressure on that for a minute, and then you can start dressing it. Thank you very much.
So do you get a lot of these toenails coming off, do you?
I think I'm doing a couple this morning, and we normally get 2 or 3 a week. Right, I'll leave you with these lovely ladies.
Right,
nice to meet you.
Yep.
Take care.
I know there's something going on with your skin, so tell
It's
me
a
a little
fungal
bit about
infection,
it.
they said.
Was that what they say?
And it's hitching like hell. And I can't get no sleep for it, and it's doing me head in. And I can't leave it alone.
Right. Where was it before? Was it just on your legs?
No, just my leg. And my back.
Okay.
You know the rolls of your fat on your skin?
Okay, okay.
It was under them where you get sweaty, that was all.
And how about on your hands?
That's only just started
It's only
since
just
yesterday.
started. Has it? Okay.
Yeah.
And when's that been most itchy?
Well, I find it's when I'm in bed asleep. I don't know, it's going... Do you want to look up my arms?
Please.
Pleasure.
Okay.
It's not nothing like what my grandson had months ago.
What was that?
That way you pick it up from somebody else's bed.
Scabies.
Yeah, he had scabies.
That's what I'm wondering about with this, actually.
That's what I wonder. It's something that's just annoying me all the time.
I can see that, yeah. Come on, Jay. Right, get off the pram.
Come in.
Get in. Go on. Sit down. Go sit down.
Hello. Hi, guys.
Let me put pram here.
Yeah, absolutely. Okay, right then. Okay, so I saw you, was it a couple of weeks ago?
Yeah.
And you told me that you'd been feeling quite tired and you'd had some blood tests and they were pretty much okay, weren't they?
Yeah.
And then you admitted that you felt quite up and down with your mood and you'd had a heck of a lot go on, hadn't you, in the last few years. The main thing we did really was give you an antidepressant and then we said we'd see you and see how you're doing. So where are we at now?
I feel a lot better.
Do you?
There's days where it's like I get up and do stuff and like I'm not like, oh God, like that. And then there's days where it's like, but it's more up now.
Okay.
I'm not getting as much like irritable and like it's quite hard to explain. It's not as bad, but it's not brilliant.
Yeah, okay. You're really only probably starting to notice an improvement over the last few days. And it will continue to improve. So I think we're definitely on the right track.
Yeah.
And no significant side effects with the medication that you've noticed?
Still the sleeping.
Yeah, I was going to ask about your sleep.
It's like before I slept like quite a lot. And since taking them, it's like I'm really tired, but I can't sleep.
Can you?
It's just this one don't like to go to sleep.
Right, okay.
He'll sleep for a few hours.
Look at you, shaking
then he'll
your head.
wake up and he'll think it's playtime at like 3 o'clock in the morning. Like, oh, it's like no outfit, it's bedtime.
Yeah, okay. The difficulty is because you're on your own with the children, you can't have anything that's going to make you really tired at night because you've got to be able to be rousable and alert. So perhaps look at we call it sleep hygiene, so look at your pattern on an evening of how you prepare for bed and most people can improve their sleep hygiene. So do you smoke? You don't smoke. So it's about no alcohol or smoking after a... Yeah. What about caffeine?
I don't drink it.
Right.
I just stick to like iron brew, Coke or what is the other one? Pepsi.
Normal volumes, less, more.
Right. I don't know, I just got in late and I always find it hard to relax when I've got in there.
Oh,
I don't see that bad.
Oh, did you? How did that go? Very well.
No, we didn't go out, we just chilled it in.
Oh,
it's so cute.
Mine is currently in Newcastle.
It's proper tall, isn't it?
Oh, he's 6'5", it's horrible. It is horrible. I try stroking his head, but I've got to like proper... I love tall men though.
Yeah.
Oh yeah, because I'll never ever be taller than him. Even in my highest heels, I'm still smaller than him.
Yeah.
It's amazing.
So it's just to think about not having caffeine after, say, 6 o'clock on an evening. I know it's difficult, but sometimes things like warm baths and warm milky drinks and lavender, and there's a few kind of natural remedies that can help. I've got a really good leaflet that you can have a read of, and you might just find that just helps. Often when we are down and anxious and worried and low, it does affect your sleep. You do seem much brighter today than you did 3 weeks ago.
It's the kids helping as well.
Yeah.
They're really, well, my eldest is really good.
Are you the eldest? Or are you the eldest? They're so alike, aren't they?
Yeah. 11 months apart.
Leaflet.
Thank you.
Shall we perhaps just have another chat in about a month and make sure that everything's okay?
Yeah.
And if it is, we'll put them on repeat prescription for a few months for you.
That's brilliant. Thank you.
Come on then, sit down.
Right then, kiddos. I'll grab the door for you.
Yeah,
All right, okay.
Thank you.
Take care.
You
Bye
too.
now. Bye,
See ya.
kids.
Come on, you two. Are you saying bye-bye? Bye-bye, hey. No.
Scabies is typically really itchy at night or when
Yeah.
you're warm, so
Yeah.
that sort of fits with what you said is happening with you now.
When I was a kid, it was really bad because she got it.
Yeah.
It makes me feel ashamed because I always keep my pets clean and, you know.
Don't feel ashamed. If I told you I've had scabies in the past, would that make you feel any better?
It probably would, yeah.
I'm not ashamed to admit it.
Can scabies cause this swelling on my face? And
No, what scabies can cause is an allergic reaction to the scabies mite. And that's why you end up itching all over, even if you've only got 1 or 2 mites on your skin.
yeah, so it's all to do with one thing.
Probably. So the cream that I'm going to give you will kill the mites the night that you put it on. So if you put it on today, it'll kill the mites. The only problem is that the mites, being under the skin, they carry on causing an allergic reaction even though the cream kills them.
Yeah.
And for the next 3 to 4, maybe even 5 weeks, you'll be a bit itchy. So we do need to carry on with those tablets.
Yeah, I will do, yeah.
But you should notice that the itch is reducing week on week until your skin has renewed itself naturally. Are there 2 other people in your household?
Yeah.
Yeah, I'm going to do the same treatment for everybody because everyone needs to be treated at the same time.
That's all right.
Now, there's one more thing. You'll need to gather together your towels, your bedding, your sheets.
I do. Look, don't worry, our bedding and everything's gone in the hot water. I call it a boil.
OK, all right, we're singing off the same hymn sheet there.
I'm sorry to ask you, but can you give me a pull-up?
Let's help you stand up. Push yourself up with your legs. There you go. That's it.
Oh,
That's it.
thank you ever so much.
All right, then.
I'll take my lurgy with me, right?
You know where you're going. Bye-bye.
Okay, love. Bye-bye. Ciao, eh? Bye-bye. Say ciao.
Ciao. Ciao, ciao.
All right, see ya. Bye.
Come on, sweethearts.
Bye. Have a good day.
Yeah. Thank you.
Thank you. Bye-bye.
See you tomorrow. See ya. Good morning, the Ridge Medical Practice. Vicky speaking.
The first time she went to the hospital, they said she only had 2 years to live.
A month ago?
Yeah.
I suppose it's like trimming a ham.
I don't want that on my Sunday roast.
A bit like alien, isn't it?
God, it was massive.
Oh dear, that's quite itchy. It's itchy, quite mad, isn't it?
Honestly, it's all over her body. It's everywhere.
How long have they been married for? Because they were so close, weren't they?
Oh, 40 years. Oh. And I wasn't going to cry.
Oh, it's okay to cry.
The like contraction pains I'm getting.
How many weeks are you now?
I'm 17 weeks and 6 days.
Morning, Emily.
Morning.
How are you?
Not very good for the moment.
You look very nice.
Oh, thank you. Try my very best.
Of course you do.
Thank you. You look younger every time I see you. You're going backward, not going forward.
Oh, thank you.
Come in. Hi, hello, Adam. Come on in. Oh, that looks painful. All right. Just remind me when you trapped your finger in a in a fairground ride.
It's been a week.
And you went to hospital? What did they do in hospital?
Went to the nurse, bandaged it up, so it should be okay. You don't need any stitches.
How are you feeling about it?
I'm worried.
Does it hurt now?
No.
Does it keep you awake at night, you know, when you're sleeping? Yeah. Just put your hand in my hand there. I promise I won't hurt you, I promise. I'm just going to have a look. If you just turn it around. What does that? That's really sore. What about on this side? Yeah, okay. So I think there's a couple of things going on here. The nail is blue and sore because it's bled underneath the nail, and that's putting lots of pressure on there, which is what's causing a lot of the pain. With all the swelling that's going on, I just wonder whether he's broken the tip of that finger as well.
Oh, right,
okay. Right. Am I making you feel more nervous? Yeah, I'm sorry. Right. What's hurting you is the blood underneath that nail, okay? And the minute I put a tiny little hole in that and that blood comes out, it'll be a bit like all the pressure's gone and some of that pain will come off, okay? Right, so how are you feeling about me just using a little hot needle to put on there? You won't feel the heat, you'll just feel a bit of pressure. Okay. All right, good lad, good lad.
Is it Kevin?
It is, love, yeah.
Just through here.
No problem, thank you. Cheers, love.
There we go, come and have a seat. Right then, how can I help?
It's my leg, love.
Oh yeah, look at that.
Yeah.
How long's it been like that for?
This has just happened 2 days, love.
Okay, it's quite red and angry, isn't it?
I was thinking about going to hospital last night.
Right, can you take your socks and shoes off for me? You've not got any ulcers or blisters or
No, love,
breaks
no.
in the skin?
No, as far as I know, love, no.
And has this ever happened before?
No, love.
Just a
no.
one-off, yeah? It looks really quite swollen. Does it feel tight?
Right at this moment, love, no. It seems it was yesterday, and I mean really tight. I felt like my leg was broke.
Right, let's have a look. I just worry whether that's infected. You've got quite a clear red line.
I mean, really,
around
I
that,
wouldn't have even let you touched it before because, honest to God, it was that painful. I felt like crying.
Yeah, I just wonder if you've got a bit of cellulitis, a bit of infection in that foot. So I think what we need to do is give you some antibiotics. Whenever you're sitting, get them feet raised up.
Yes, love.
Right, let's check your temperature.
Yeah, no problem, love.
OK, that's good. Now, are you allergic to anything?
No, love.
No.
No.
So I'll give you an antibiotic that we know is good for the skin.
OK, love.
I've given you a week's worth.
OK, love.
The other thing I want you to watch is this redness here. You can see almost a line here, can't you, around it? Keep an eye on that. If that redness extends and gets more rather than improves with this, we need to see you again. So keep them legs raised up.
I will do, love. I will do.
All right, then.
OK, then.
Take care.
Thank you very much for that, love.
Bye-bye. Bye-bye.
Bye-bye, love.
Bye-bye. Bye-bye.
Bye-bye, love. Bye-bye.
Right, just pop your hand down there for me. Okay. Right. Why don't you look the other way while I do this? It's best not to look.
Me, not the door.
Okay, now it's really important that you keep as still as you can. Okay, Adam. Here we go.
It's hurting.
Okay, just bear with me a second.
It's hurting a bit.
I know, darling. Here we go. Are you okay? You just need to do it a little bit more, then we're there, okay? It's going to hurt a little bit now. Here we go.
Well done. You're doing good.
That's it. Okay, so some of that pressure should come off now. Are you okay?
Yeah.
Not too bad? Yeah, you've done really well. So I'm going to book you back in to see me after you've had the x-ray done. Keep that on nice and loose, okay? Do you still like fairground rides? No. Did you go on the waltzers? They've got waltzers.
That's the one he got injured on.
Oh, is it? Oh, we won't talk about the waltzers.
How's your son?
It's not good. His knee's out here, and it's all fine.
He's had a bit of bone lump removed from his leg, but he can't walk.
I'm having to do Luke's paper round.
Oh, he's got a paper round.
Yeah. It's embarrassing. Doing a paper round at my age. Right.
Oh my God.
Come through.
Hey, okay.
Hello there, you're all right. I've got a couple of medical students with me, is that all right?
Yeah, it's fine. Yeah,
all
it's
right. Come through, sir, take a seat.
Right. So.
Dear, you seem in a lot of pain.
Yeah.
What's going on?
So 20 years ago, I got run over. I broke my leg in 3 places.
Oh dear.
And when my femur grew back, it grew back shorter, so I limped, and my hip bone kind of wore away. So they had to screw it.
I see.
But this last month, I've been getting it really bad in both hips. Sunday morning, I woke up with just really bad pain in my hip, and just my right hip. I can't put weight on it. I'm just getting constant pain all the time.
And you don't remember falling or injuring it in any way?
No.
Right, okay. And how are you in yourself? Any fevers?
Yesterday, I felt like I was going to pass out.
Right. Is it because of pain?
Yeah.
Do you mind if I have a look at it?
Yeah, it's fine.
Yeah, okay. If you just get on.
I can't lift it.
You can't lift it. Right, just give me your hand.
Oh!
It's all right. Right, so if you just relax your leg. Okay, I'll try to be as gentle as I can. Okay. So that's the best you can tolerate?
Yeah, that's how, yeah.
Okay. Sorry, I'm just going to try and move the other way. You're not able to do that, are you?
Yeah, it hurts.
Right. This is clearly a bad one.
Blimey, give me a shot, fine.
Press that green button there.
That's it.
No, not that one.
No.
That's emergency alarm.
Just looking, I think I spilled some coffee down my top. Oh my God.
Oh my God, I'm locked out.
Hello there. Hi. I think you've come through the wrong door. You see, this is not room 6? No, that's next door. Oh.
John Williams, please.
That's me.
John Williams?
Yes.
All right. Excellent.
I was already at the door ready.
Excellent.
Do you have any thoughts? Have I given you any clues by what you're looking at?
Dear me.
Just relax. That seems to have a more range of movement than this one. This is clearly a bad one.
Yeah.
That's okay, sir, if you just... So you did have a surgery onto this hip joint?
Yeah.
And how old were you then?
From what I can remember, I think I'm about 14.
14?
14, 15.
Did they tell you what the diagnosis was?
Arthritis, I think it was. But they did say it might not last that long, and if it does, it'll be a hip replacement. They said that when I was a kid.
Yeah.
But I've kind of just... I've been fine. I play football, I go running.
Yeah.
I'm kind of fit and healthy.
Yeah.
But then every now and then, I get quite a bit of jip.
Okay, I can give you some painkillers now. And the other option is I can have a word with the hospital doctor.
Yeah.
Okay, and they can assess you there.
Yeah.
Okay. I'm just going to give him a ring.
Yep.
My name is Dr. Said, I'm calling from Ridge Medical Centre. I've got a patient, so he's 29 and he's had previous surgery to his right hip. Now today he presented with a 4-week history with gradually worsening hip pain. I was hoping that if you could assess him, please. All right, thank you very much. Thank you. He's just going to have a chat with his senior colleague and then they'll ring you straight. Okay, so they've got your details now and hopefully they'll ask you to go straight on the ward and then they'll assess you there. Is that all right?
That's fine, yeah, great.
Okay. You gonna be all right?
Yeah.
Good morning. Hiya, new baby.
Yes.
Congratulations, Daddy as well.
Hello.
Hello, love. In you come. Take a seat.
Thank you.
Oh, another one.
Yeah. All together 5.
Full family. Yeah. So this is baby Syed.
Yeah,
7
baby Syed.
weeks old.
Yeah.
And then, so you went to out of hours yesterday.
Last time to till this time, he is never sleep. He's just crying like this, still
So
crying.
ever since he was seen in hospital, he's cried.
Cried, yeah.
Is it a cough or is it?
No, nothing, no cough, nothing. I think his tummy's problem, something like that.
Right. Is he breastfeeding or
Yeah,
not?
breastfeeding, yeah.
Is he taking plenty?
Yeah.
Yes, taking plenty. No fever?
No.
Right, take his clothes off and we'll have a look at him. Any vomiting? Yeah. Big vomit or little vomit?
Big.
So if Mummy's feeding him there, would it come to here or would it come to there or would it come to there? Just down here.
Chup. Bas.
She says, no diarrhea?
No.
Normal poo? Has he had wet nappies, dirty nappies?
No.
Not as many wet nappies. I'll just have to ask the hospital to look at him again because I can't find any reason. But sometimes babies get a condition where they do this big vomiting and it's a common problem. And if the vomiting flies out, and we need them to check him because now and again they have a condition where they might need a little operation. It comes on about this age. If he's vomiting after most feeds and not having the wet nappies, it could be that. So now then, I can either ring the hospital now or you can take him home, feed him, and I will see him again this afternoon and then I'll ring the hospital then if he's no better. Okay. So you're very experienced parents, aren't you? That's why it's worrying because you know how to look. Yeah. Shall we just try him with a little bit of Gaviscon? You can mix it with some water and see if that helps him, and if not, we'll think again. Okay, see ya.
See ya.
Where'd you get one of them from?
I'm cute.
Can I have one?
You can have one. My husband bought me this. Watch this. This is best bit. Go sleep.
I love it.
Remind me what your little boy's called. Connor. Did I tell you that my Shay was meant to be a Connor?
Oh, really?
Yeah. And my come in, have a seat, and my cousin just had a baby just before him.
Right.
About a month beforehand, and got in and called him Connor.
Oh, the best name.
Right, my love. The last time I saw you, you were struggling with these jerks.
That's right, yeah.
Because you've always said that it's the epilin that's been the best one for you, yeah?
It is, yeah.
So, last time I saw you, we were pushing it up a bit?
Yeah.
How are we doing?
Still not great.
And the jerks are still the same as before?
They are.
Claire, we don't know why this happens. We don't know why this happens. Sometimes it does.
But it's not just the jerks. It's so difficult to explain. But, like, I'd gone shopping, and it's a feeling of, like, I'm almost not there. Like, I want to pass out and everything's going on around me.
How often's that been happening?
Every other day. Yeah.
Is that new?
It used to happen before.
Did it? When you were? Can you remember it happening when you were younger?
Yeah, because I used to have, and touch wood, they stopped, but the drop seizures. So I would walk and be on the floor, but not being able to feel myself.
And how old were you whenever you had those?
About 18.
About 18, right? You used to have drop attacks, okay.
Yeah.
So do you think you've been free of those since you were about 18? Or?
Yeah. Probably since the epilin.
How do you feel about increasing your epilin further?
If that's a possibility.
Yeah. You know, we can go way up in your epilin.
Yeah.
It's just always the side effects we worry about, but the main ones that people complain of are weight gain and tiredness.
Weight gain, like see, that's an interesting one.
Do you think?
I do feel like I have put a bit of weight on.
I mean, I'll be honest with you. I think you look great. But actually, the last time I saw you, I thought you looked thin.
Oh, really?
Yeah.
Okay.
And where maybe if you have put on weight, it's going in the right places.
Okay.
But just keep an eye. And you know, if weight gain bothers you and is something we need to talk about, we'll talk about it.
Because it just tends to sit round here. That's obviously having children, that's and cesareans, that's going to be a given anyway.
Tell me about it. Yeah, I know. And if you can tell me how to get rid of it, then I'll give you £1 million. I'll find it and give it to you. Radio. So we are going to go to 900 and 900.
Okay.
Yeah. Is that?
Yeah. Just anything, just to try and
Right, my love, you take care.
Yep.
Good to see you.
Yeah,
Good
you
to see you
too.
looking well. And thank you for coming. You can come back because you've just been super duper, haven't you? Yeah.
Right. My name's Dr. Said. What can I do for you?
She were in yesterday and they've referred her for a patch test doing. I think it's hives what she's got. It's like they're not, I don't know what they're diagnosing her with. I'm just going, they're giving her something and then coming back.
Right.
So I don't actually know if it is hives what she's got.
Oh dear, that's quite itchy. She's quite mad, isn't it?
This is itching that bad. She's crying to me. She's wanting to put cream on her own.
Right.
It's all over her body.
Yeah, I've been going through the notes. Apparently, she has been referred to dermatology, but it's really important that you keep her away from the sun and keep her kind of covered and use the sunscreen until we get to the bottom of it. Right, I can see that she's quite itchy.
This is all, honestly.
Let's have a look.
It's bad. Nyla, can I have the phone a minute while Doctor looks at you?
Oh, that's where the noise is coming from. It's coming from. Right, so where did you see the most of the rashes? On the face?
Her face swells up, her eyes swell up the most.
Right.
And the backs of her legs have started today. And then it was under her leg. She just keeps scratching upon scratching, so it swells and then it goes down.
Yeah. Let me see. Have you noticed any rash in her scalp?
You know, like when you get goosebumps, and it'll be, honestly, it's everywhere in a minute, Keela. You can see how it leaves the skin marked.
Yeah. So she's had some cetirizine yesterday. Is that helping?
Obviously not, no.
And what have you been using in the past?
Oilatum. They're just giving me a Vino, Oilatum.
Yeah. I think because she's quite itchy, I'd suggest her using the calamine lotion again.
Would you?
Yeah, because it really helps with the itch. Now, carry on with the cetirizine.
Yeah.
And...
Don't itch it, darling.
I'll give you a cream.
Right.
Okay. Now, apply very thinly on the face, like literally with just the tip of your finger.
Yeah.
And make sure that nothing gets into her eye.
Right.
Okay. And we'll see how she responds to that.
Yeah,
okay?
that's great.
I would expect things to settle in the next few days. If the rash gets worse or she's not liking the cream or symptoms get worse, then come back.
Come here, no. Do you want Mummy's phone back?
Can you say my name?
Let's go.
What is it?
Let's go.
Oh, it's a skeleton. Skeleton. Bones.
Oh, a skeleton.
Yeah, it's a curtain.
A skeleton.
Right, so
Thank you so much.
All right.
Say thank you, Nye.
Bye.
Say bye.
Bye.
Right,
See you later.
take care.
Oh, go on then.
The remote name could not be resolved. Bloody hell. Gas! Gas!
Oh, don't ask me to do it again. Don't ask me to do it again.
But look, what's it doing? Oh my God, how many's open now? Jesus.
What?
What are you doing?
I can't even spell my own name.
Oh, bloody hell.
Hiya, Vanda.
Hi.
How's it going, diabetes-wise?
Fine, really, just as it has been.
Yeah?
Although I did have a really bad hypo where I felt I was going to pass out, and that is the first time ever.
Said it was the worst one you've ever had.
Yeah, I've ever had. But I've only had that once.
Tell me about if you've had any other funny shaky doos.
Yeah,
you do have them, don't
I
you?
do have them, but not very often.
But have we got a new thing with this liver condition? You've got this little bit of fibrosis in the liver, haven't you?
Well, is it a little bit? Because, you see, I don't know where I stand with this.
She's really confused because the first time she went to the hospital,
Yeah.
the liver guy said pretty much she only had 2 years to live.
Right. It's a bit of a shock.
Yeah, and we couldn't...
When was that? I hope it's more than 2 years ago.
A month.
And we couldn't understand
A month ago?
Yeah, because she was having liver function tests.
Yeah.
And nothing's ever been flagged up.
Yeah.
And so it was a massive shock, wasn't it?
Yeah.
Three letters ending in Y. Very good.
Hello, come and have a seat. I'm Linda Eves. Brought a little helper with you today? That's my little daughter.
What's your name, darling?
Khadija.
And what does your mum do for you to help?
She pushes them over and she helps you up.
Sorry, can I ask the embarrassing question? You're not using contraception at the moment because you don't need it, is that right? Yeah?
I like purple and pink.
Because they're your favourite colours, aren't they?
Yeah.
OK, what I need to do, I need to have a look inside your mouth. All right.
She has cleaned her teeth this morning, Doc. It's just, it's bad.
You see, I didn't realise that all these different things stem from diabetes because it never affected me.
Vanda suffers from type 2 diabetes and also has a condition called non-alcohol related steatohepatitis. This is a condition where fat deposits within the liver cause inflammation. Unfortunately, Vanda has been unlucky in that her fatty liver has progressed to inflammation and scarring or fibrosis.
You know, I still find it so hard to believe that it's still not showing up.
It's well recognised that the tests we can do often don't pick it up. Well, if you think about your liver, you can lose a kidney quite easily, can't you?
Yeah.
And still be fine because you've got enough reserve. Yeah. With your liver, you can lose a lot of your liver.
He said I've got plenty of meat inside.
Meat inside? What did he mean?
Like fresh meat, if you like. You know, top and bottom were knackered, but middle bit were
right. So plenty of liver meats, he means, doesn't it?
Yeah.
It's a bit of a pill to swallow because you've never been a drinker. You've got
no.
Yeah. It's the diabetes. I'm not as negative about the outcome. Early signs of liver fibrosis are reversible with lifestyle and improved diabetes control. However, as fibrosis progresses, there's more chance of it progressing then onto liver cirrhosis.
Is this likely to progress faster, liver, or is there anything she can do to help herself?
Yeah, what we want to do is keep everything nice and stable. But it looks as though there might be enough liver functioning well enough to keep you going. So I'd be optimistic about that.
All right, that's good.
You're on 2 medications, aren't you?
Yeah.
You're on your insulin and you're on your metformin. What I think we should do is cut your insulin down by at least half. The metformin, I'll just wait at the moment. I'll look at your kidney function as well.
OK.
So, does that all that make sense?
Yeah.
Right.
Yeah.
See you in 4 months.
Right. OK.
Right, cheers. See you later. Cheers. Thank you. Bye.
Shall I leave him a message to say, please contact the surgery?
Yeah, please. Hi, it's Dr. Tatham.
That was my impression. Rubbish, wasn't it?
My kids want to take the mick out of me in my East Yorkshire accent. No. No.
I like that.
Hi, I'm Dr. Khan. Nice to see you. Nice to see you. Hiya, you're right. Who have we got here?
It's my daughter, Caprice.
Oh, hiya, Caprice. That's a nice name.
Thank you.
Right, I understand you've got a lipoma. Yeah. And what do you understand about the term lipoma?
Nothing really. It's just like a fat growth.
Yeah, it's just a lump of fat. Sometimes the body just kind of deposits it in this kind of circular growth.
Like the past 2 years, you've just noticed it and it just seemed to get big all of a sudden.
Maybe I've had more holidays and noticed it more.
Shark fin when he's swimming in water.
Is that why it's just kind of come above the waterline?
The meg.
Yeah. Should we have a look at it?
Of course you can, yeah.
Oh, it is a big one, isn't it?
Yeah.
OK. Right, yeah, we'll take that off for you today.
That,
yeah.
I've seen one bigger than that before.
Yeah, good. No, it's my first one. It was bigger than I was expecting because in the letter she's referred to it as a 1.5 centimetre lipoma. So I was just surprised. All right, so we'll get it all out. We just need your top clothing off.
OK.
So if you just lie on your front.
On my front?
Yeah, that's it. Right, so I'm just going to give you your first injection now. So here we go, it's just a sharp scratch. Can you feel that?
Yeah, but it's not sharp pain.
I'm going to start, and then if it gets painful, let me know, because I think what you're feeling is more pressure. But we'll have a look and see what you think. What does that feel like?
I felt like a scratch.
Is that let's try a bit more.
You don't want to part with it, really, do you? Have you got quite attached to it after 20 years?
Right. If it wasn't big before, it is now, because it's full of fluid.
Get to play football with that when it comes out.
Right, let's see what we're dealing with now. Is that okay?
Yeah.
Yep.
Come through.
Hiya.
Hello there. Hey, come and take a seat. Right, what can I do for you today?
I think you received a letter from the hospital. I just come to discuss that, really.
Right, what was it about?
Well, I went in for my thumb. They said I fractured it, and then on X-rays they showed it as arthritis.
Right, so is it only one joint, or?
No, it's well, this problem's been about 3 years now. It started off with my elbow, my wrist, my thumb, and then my other joints, my fingers as well.
So does it come and go?
Yeah, it comes and goes. It stays for about 3-4 days.
Right.
And then I won't be able to move the joint as well.
Okay.
And it swells up as well, like with my thumb on the side of here, on both sides, it quite swelled up.
Right. Have you noticed any other symptoms at all, like red eyes or any ulcers in your mouth?
No.
Any rashes anywhere?
No.
Okay, any changes to your nails?
No.
No. Do you mind if we just have a look?
Yeah.
Right, so let me just have a feel of your wrist. Just have a feel. How does that feel when I pressure
fine.
on that? Let me feel the other one.
Yes.
Okay. And that's okay.
Yeah, that's fine.
Are you normally stiff in the morning?
At times, yeah, it's mainly my fingers and stuff that I feel quite stiff.
And how long does that last for?
Not long, probably about 20 minutes or so.
Right, okay. Now, what the hospital was suggesting that they think this could be arthritis.
Yeah.
Now, arthritis could be of different types.
Yeah.
One is inflammatory arthritis,
Right, yeah.
where your body's own immune system attacks your joints.
Right.
Okay, and the first thing that we do some blood tests. If they come back positive, then what I will do the next step will be a referral to rheumatology.
Right.
Okay, so I'll do those set of bloods. Hopefully we should get results in a few days.
Right.
Okay, and then I'll talk to you once we have those results
okay,
back.
that's fine.
Okay. Is there anything else you want to ask me?
No, that's all for now.
Is that all right?
Yeah.
Okay.
All right then, thank you.
Take
See
care.
So Ellie, you can see that it's kind of a pinky colour at the moment, which is a cutaneous tissue, but just lurking underneath that you can see spots of yellow, and that's the lipoma.
How are you doing?
Yeah, I'm doing good. Yeah, I'm quite relaxed now, yeah.
How are we doing? It's impressive, isn't it? Yeah.
I suppose it's like trimming a ham.
I don't want that with my Sunday roast.
Like alien, isn't it?
God, it looks like an organ. Massive.
A church organ.
Are you okay?
Yeah.
Yeah.
I'm good, thanks.
We're nearly there now. It's coming
Good.
out. Okay, we're going to need a big pot for this one.
I think we've only got one size. Yeah, it's nearly there.
Good.
Nearly there. I don't think you're going to get all that in pot that we've got.
It looks a bit like a chicken breast.
It does a bit,
before
doesn't it?
it's cooked.
Yeah.
So how many stitches will this take?
Probably 5 or 6.
Do you have to do needle crafting for this as well?
Yeah, crochet, knitting. You know what? I can't.
Oh.
If you can do that, you could definitely do buttons.
I don't know. I've never tried. Right, I'm just going to give it a cleaning. We'll put a dressing over it.
Okay, fine.
It looks good, Dad.
Good.
Oh, thanks, Caprice. Does that feel better?
Brilliant.
I've lost my tongue piercing, Veronica, and I'm not right happy.
Oh, that just really...
What? What?
I just can't imagine. Why would anybody want to stick a thing in the tongue?
Because it's satisfying.
Is it?
I'm coming home. I need to pick up my maternity notes. She's coming with me. She's coming with me to the hospital to Leeds, she said.
Sanam Rafiq.
OK, I'll speak to you later.
Sanam
then,
Rafiq.
OK, I've got called in. OK, bye, babe. Bye.
Hi, my name is Dr. Hack. I'm seeing you instead of Dr. Yunus. Is that OK?
I've got a scan as well.
Have you got a scan today? What time?
It's at 1:30.
OK. I'm sorry about the wait. Please have a seat.
Okay. No, it's okay.
So, what's the problem?
I've got, they're like contraction pains I'm getting.
OK.
They're just like lower down.
Lower down.
I'm getting shooting pains in my vagina. And yesterday there was, do you know, in my back passage, there was severe pain there. Do you know, like now when I'm sitting down, I've got on and off coming pains.
OK. How many weeks are you now?
I'm 17 weeks and 6 days. But I went into early labour with Malika originally.
How early did you go in?
I went in 18 weeks and then she had a heart problem. And then I went on to like steroid drip. So I went in quite a few times.
OK.
Yeah.
OK, so you're worried about that?
Yeah.
OK, and which number pregnancy is this yours?
It's fifth.
OK,
It's
are you
just
weeing OK? No burning,
the weeing's
stinging,
okay.
or no blood or anything that
No,
you've
nothing like
noticed?
that, no.
Anything? OK, and this pain, when did it start?
It's been, originally I had a car accident, and at that point they did start, and then they've settled. And then since yesterday, they're just getting worse again. But it's like in my back passage, I've not had it. But then since yesterday...
Feel as if, like, you know, there's a pressure.
It's a pressure, that's what it is, and even now, it's not easy enough.
Feeling animal?
Oh, I've got loads. I love animals.
And one slightly weird question. You don't keep birds as pets?
No.
Not a pigeon fancy or anything like
No.
that? OK.
So he's currently on holiday and he's been scratched by a cat. He wants to know if he's been covered for rabies.
Do us a favour. Open that for us, please. Got a spider in there. Melody, she don't like spiders.
What kind of dogs do you have?
The Staff and the Shih Tzu.
Oh, nice them Shih Tzus, aren't
Oh.
Is it a hot water bottle? I thought you were carrying a rabbit. I was like...
Tell me about your dog.
My dog is 95% idiot, 5% staffy.
I'm coming, Pat, I'm coming.
How are you?
No, not too bad, my love. Thank you very much. Yourself?
Yes, I'm fine, thank you.
Good.
Even better at 5:30 when I'm done.
Ah, well, yes, indeed.
So, you were only taking amlodipine 10 milligrams, but your blood pressure was still raised. Thank you. You've been bashing yourself.
In actual fact, yes.
What did you
Basically, I opened the car door and the corner of the top of the car door was smack right in it.
Oh, dear.
It was painful, I'll tell you straight, it was.
What about the reason that you stopped taking all these tablets were the night sweats? Are they staying away?
I think so.
Good. What's your plans today?
I've got to go to a garden centre to get some fish.
All right.
It's a blue koi.
Very nice.
Yeah, but no, not for me. It's
all right.
A replacement for my friend who's on holiday, and unfortunately the sun got to him, virtually boiled him, which is not nice.
Were you looking after him now?
I nearly cried when I saw him. I'm supposed to be looking after him as well. It doesn't help, does it?
So you're going to come clean and tell him the truth, the whole truth, and nothing but the truth?
Well, I didn't do it. It's the sun that boiled him, not me.
You're not just going to pretend that they're all OK?
Well, no, he was rather really fond of these fish, and I'm trying to get him some replacements before he comes home, because he'll go absolutely mind-boggling crackers if he finds them missing. And it isn't my fault, obviously.
No. OK. Your blood pressure Average is perfect.
Oh.
So we need to just leave your meds as they are now. You all right with that?
Indeedy, yes.
I hope you find the fish.
OK, my dear, thanks ever so much.
You're welcome. Let me get this door for you.
Yeah, indeed. I'll see you later, Pet.
See you later.
See
Bye.
you now. Bye-bye.
Okay, let's have a look.
It's there. Yeah. Yeah.
Do you want to just lie down? Let's have a feel. Okay. Can you just lift your top
Yeah.
for me? Okay. Just relax, okay?
It's just there.
Tender one.
Yeah.
Is that quite tender, isn't it?
Yeah.
It's a bit difficult to sort of say what is causing it, especially with your background history of sort of you're nearly the same time that you went into labour with your daughter, and obviously your tummy's soft at the moment. Yeah. You are tender, but you're tender in the lower part, like where the uterus is. Now, obviously that can be due to various reasons. I think the best option would be for you to be checked out in the maternity assessment unit. They can put the machine on and have a listen to the baby's heartbeat as well. How does that sound to you now?
Yeah, that's fine, yeah.
Let me see if I can ring them up. Hi, my name is Dr. Huck. I've got a lady who's 17 weeks pregnant. Basically, she's got a history of having a premature labour at about 18 weeks with the first child. So 2-day history of lower abdominal pain, which has just worsened overnight, and it feels like she describes them like strong contractions, and she's having some pain in her back passage, like a pressure. I just felt that if you could have a look at her. She went into labour at about 18 weeks?
Yeah, I'm 18 weeks tomorrow. Yeah. I had to have steroid drips with...
Sorry, she went into premature labour at 18 weeks and then she was having steroid injections. When was the baby born?
I delivered her at 37 weeks then.
She delivered at 37 weeks?
Yeah.
Yeah, OK then. Thank you so much. Thanks, bye. Yeah, they'll see you on the maternity. They said that once you've had the scan, you can go straight to her.
That's fine.
Anything in between changes, like, pain gets any worse, then you'll have to go straight away to the hospital.
No, that's
Take
fine.
your book with you.
No, but that's fine. Thank you so much. Thank you.
You're welcome. Take care. Hope everything goes okay for you.
Thank you.
Let me just show you that I wasn't kidding you.
Yeah, well, I'll have to go back and look, but I don't recall getting a WhatsApp from you.
Sorry it's late. We have a venue. What shall we have as a theme? Lol.
I don't recall getting that at all.
Well, I think that 2 ticks means you've read it, doesn't it?
Does.
It means you might be avoiding me.
Oh, no. No.
New glasses on.
Oh, did
Hello,
you know?
Dr. Khan. How are you?
I'm all right.
Oh, I'm so sorry about your dad.
Oh, me mum. Me mum.
What do you mean? No, my mum's all right.
Oh, God, don't say that.
I mean, my mum's all right, but what we've heard about her.
Yeah. Come
but
and sit
I know,
down.
but my poor dad. We've had a right time, haven't we, Dr. Khan?
Tell me what happened to your dad.
Well, he had pneumonia. Goes to the hospital a couple of weeks later, and his heart, the valves in his heart, they were just...
Oh, no.
And it was just a matter of days. And he went. That was it. But you know what? He went peacefully.
Did he?
Yeah.
OK.
Yeah, he did. He went peacefully. And you know what? My mum hasn't been the same since.
No.
Oh, bless her.
How long have they been married for? Because they were so close, weren't they?
About 40 years.
Oh.
No.
And your mum's poorly.
And I wasn't going to cry.
Oh, it's OK to cry. Honestly, it's OK to cry. That's normal.
Oh, I don't know.
Well, why don't I come and see her at home?
You can come and see her anytime. But you know what? She's always asking about you.
Oh.
She is. I've got a Marks and Spencer's cream cake in the freezer waiting for him.
Has to be Marks and Spencer.
You know me so well. Marks and Spencer, cake. It's my favourite word. Right, we're doing your knee.
No.
No?
You're doing that and...
Yeah. Tell me about it.
It's that look at it, Dr. Khan.
So where are you getting the pain there, Diane?
All right.
Yeah. And there.
And there.
So what we'll do, we'll go into this area here, and that will
Okay.
make its way along those there and there.
Okay.
So you know the drill. Can I get an orange needle?
Yeah.
Please, Kat? Right, Diane, if you just come and rest your hand on here for us.
I will, Dr. Khan.
You know, Diane, you can call me Amir.
Amir.
Yeah.
I will do. I will do.
Great.
Dr. Carl sounds so
I know
formal,
it does,
doesn't it?
I think
will.
we're way past that.
It won't let me call him Amir.
No.
I have to call him Professor.
Professor.
Yeah.
So here we go, just a sharp scratch. I know it's not very nice.
Well done. You okay?
Yeah, I'm fine, thank you.
I've not put it all in because I was getting ready for a knee, so I've only put
was you?
yeah, it's a small joint. There you go.
Smashing. Dr. Khan, you take care.
You
Lovely
take care.
seeing you.
Really nice to see
Oh,
you.
you too. Oh, do you know what? And I'll see you again. Come on.
will.
Where's I'll give you one.
see you.
She looks nice in her glasses, doesn't she?
does. Yeah, she always looks nice.
Oh.
Yeah, yeah, you look nice. Oh, see you soon,
See ya.
Dr.
Bye.
Khan. Bye.
Dan, just press that green button on the left and the door
This
will
one?
open. Yeah, that's it. And then just press.
Bye.
Cheers.
See you later.
I know. Okay.
Right, thank you.
All right, all the best.
Thanks a lot.
Okay, cheers.
Thank you.
Thank you. See you later.
See ya.
Okay then, thank you for seeing me.
All right then. All right, look after yourself.
Okay, thank you very much.
Take care, my love.
Thank you.
Bye-bye.
Bye.